There we go, Dr. Telfair. Try that and see if you're able to. Project.
Ms. Rachel, can you see that? The screen?
Yes, you're good. And it's in the correct mode. When you first opened it up, it was in that weird presenter mode.
Got it. Okay, thank you.
everybody. We'll get started in just a few minutes. We're going to give people a little more grace coming on. And Rachel and I'll monitor our emails for a few minutes to make sure folks have the information that they need to get on. If you notice, we don't have a lot of Rachel McConaughey's this morning, so everybody's using their own link, which is a beautiful thing. Not that we couldn't use more Rachel McConaughey's.
I don't know that the world can handle too many of me.
Okay, it is officially 10:05. Let's roll. We have 20 people on. I feel sure we'll have more people join in a few minutes. I believe we have about 40-ish people that signed up for this, but we're going to go ahead and get started and know that other people will join us. Again, this is sponsored by Healthy Savannah and CGIC and Georgia Southern University. And we want to welcome back Dr. Joseph Telfair, who is our instructor. And so let me just say, Dr. Telfair, we were on a call earlier, just yesterday, just talking about utilizing some of the information that you shared
How you doing?
last week. And
Good. This Miss.
we're just so thankful to have the opportunity to learn from you and from each other, and be able to actually take the information that we're gleaning from this and actually put it into action. And so with that, I'm going to turn it over to you, and welcome back, and thank you so much.
Well, thank you, Ms. Roberts, and thanks everyone for being on the call. I hope that you could see my screen as well as hear the discussion. So we have a good amount of information covered today, and I know that close to the end we may have a few drop-offs. So I will actually just jump right into it. So if you will, we started last time around ending with the discussion around philosophy. And so sorry about that. The philosophy, has more to do with decision making, and what we want to be able to talk about when you're thinking about development and planning. You think a lot about how you're going to interact with other people, how you're going to do the pre-planning and the work. So the recommendation is very strongly tailor what you're going to do such that it really connects with the individual programs, with the institution and community, the people that you have, and connects with them on these things here. And these are just a beginning list of things, but really respect the culture, where people are coming from, what they believe, how they interact, how they do what they do, what are their values, what do they hold important, and the work that you're going to be doing with them. And then what brought you there? What are the concerns or the things that really brought you there in the first place? And so the idea here is to work as best you can with them without avoiding any kind of either duplication or redundancy that in and of itself does not allow you to really focus on what it is that you're trying to get done. And program, that's one of the tricky things, by the way, and when you're developing a program, is that we work in communities and we work with each other, and our vision generally is way bigger than what it is that we can actually realistically accomplish. And I'll say that again, what it is that we think needs to get done is generally much bigger than what we can realistically get done. And so it is so important at the very beginning of the process, and we've said this before, that you adapt an approach that allows you to address the key issues that you prioritize, and to incrementally address the challenges that you can accomplish. So 90%, given the skill set and given the background and training and just the abilities and competence and resources that groups like this that you all really have, you could get mostly like 90% of things done. There are going to be a small group of things that just of tasks, of targets, of needs that are going to just be so vexing that they're really hard to accomplish in a really period of time. So I would just say, just be prepared that you're not going to get everything. And the program itself, there's no such thing as a perfect program. And there's no such thing as a perfect design of a program, or even perfect services. There are services that will accomplish most of what you need, but there's still going to be gaps, which is why we exist the way we exist. So I would just say, nurture the linkages that you have between the groups that you work with in terms of looking how they're going to work together. And I always encourage you, and we always encourage you, us who do this work, always encourage you to make sure that you have a shared decision-making process, and that any intervention that you're going to put together, independent of what that intervention is, any kind of change effort you're going to make, which is what essentially an intervention is, make sure that you have some means by which you are assessing the project itself, either through monitoring or evaluation, and you're making sure you're getting, feedback, honest, straightforward feedback about how things are working. Because a lot of times, people who are receiving service will receive the service, say thank you, and move on. That's good because that's what you want, but you also want to know and answer critical questions as it relates to, is it working the way it should? And so that is so critical, important, and so please continue to do that. The other bit that it's something that I have, because this is the training, but for this group, I doubt this needs to be reminded, but involve those who are the ones that are traditionally been left out. This is sort of the way y'all work and the way you do what you do. So I would just say, make sure that in the planning process, going back to what we said earlier, if I can, yeah, about cultural values and concerns, if you involve those that are usually left out, you will begin to address in a really good way the persons who are values, concerns, and work. So what is important, though, is that in your delivery of services, particularly in the planning of the services, you try to have a really good picture of what things are going to look like, either in the clinical setting, the social behavioral social setting, mental health setting, or the organization itself. Because remember what we said earlier, the organization have to be in line with, as best you can, get the services done, because you have to include existing issues and address existing problems and risk and barriers and resources. And that's where the organization and institution will come in, because they work at a macro level that allows you, or a large level that allows you to do this. And it allows you to have a bigger impact related to these factors. So I would just say, as you're thinking about putting these programs together, make sure you have a really good baseline idea of where things are. A lot of the programs that you're working with did not come out of whole cloth. They grew out of experiences, they grew out of previous work, they grew out of concerns that had existed for a while. And what you're doing and what the work you're doing is to address these issues and concerns. And make sure you establish a basis for why you're providing the services of the program and setting priority. So the critical piece here from this one is that by putting together the bigger picture, you need to make sure that the picture itself, or what you're trying to do, is consistent with the priorities that you've set, and stick to those priorities to make them work. Now, how do you do that? Well, you do a couple things. First of all, you establish a basis for targeting the interventions in the services. In other words, the change you want to make, and then the services that you need to make that change. Make sure you establish that, and make sure that's consistent with your values, with your belief, with the other things we mentioned before. Make sure that you do both a needs and an asset assessment. It's not enough to just say these are our needs, but you also need to assess what you have, your assets. What are out there? What is the kinds of things that you will allow you to carry out what you need to carry out? And do you need to, by using what you have, and you could look at between the need and then what you have, what is the gap? And the gap is where you focus your services, your program planning, your development, your work with other people, and make sure that you have that. And again, make sure that you have some kind of surveillance, some kind of monitoring evaluation of a program that is both short-term, which is summative, and long-term, which is formative, that allows you to carry that over in the long run. And then, of course, establish a basis for comparison with other services programs as well as previous work. The thing that you don't want to do, and this is really critical, is that when you're in a program that has so many connections, in other words, it's one program, it may be multiple programs, then those multiple programs have multiple services, those multiple services then have multiple contingencies and so forth. It can get pretty large, a big morass, and you can go down the rabbit hole of just reacting as opposed to being anticipatory and planning. And that's what you don't want to do. You want to establish some degree that which you compare and assess. And you make sure that you build into your planning and your program development, a regular means by which you're going to determine should you continue certain programs and services or not. and that you have a means to do that. So if you establish a baseline for that work and you keep going back to that baseline and saying, is it working the way we think it should? Are we carrying this work out? And being honest about it. Because a lot of times we work in an arena that responds a lot to need. And it's really, really hard to turn someone down, because that's just not how we want. That's not how we're built. That's not what we do. But reality is that if you're going to have a sustained program, and you're going to have a program that's going to be strong and long lasting, and that you're going to really honestly meet the needs of persons, you're going to have to make some tough decisions. But you also should have in place a means by which making those tough decisions are based upon the evidence and based upon what you really have. And it doesn't mean that you can't let your heart make decisions. I'm not saying that, or let your gut make decisions. What I'm saying is that you should have as a priority evidence, and then as a priority, making sure that the program as you designed it is working the way it should and carrying out the way it should. So compare services. Do you have that? And going back to the very first slide in this grouping is the wing to avoid redundancy and duplication. And that's by comparison services. In other words, then you have many types of services that provide many type of programs that provide the same services, in the community, like the ones that you're in. Well, that's true. The reality is that how much duplication do you have? And that because duplication makes it really a challenge to get the resources you need, and also makes it a challenge for those who are supposed to receive the service, make decisions about where best to get those services. So keep that in mind as you put together the philosophy and purpose of your program, and make sure that your purpose is designed to work yourself into a position where you can make some decision of whether you should continue or not continue with either program or services. So I'm going to leave it at that and move to something that I think is also important. How do you make these decisions? So first of all, again, establish a baseline of understanding the feasibility of carrying out any type of assessment or of data building or work you're going to do for that program. And so this is called a pre-existing phase. And this pre-existing phase includes reviewed analyses of your needs assessment, review and analysis of any kind of group and work you've done, the extent you've collected information from other people, and so forth. It's a bit of a data-driven, but it's also a part of what you do already, which is that you're making decisions based upon the information that you have. And so the other part of that is make sure that whatever you're doing is up to date. If you're in programs, like many of the programs that you have and many of the services you have, many of the institutions you have, they've been around a long time, and they've been providing the services they provided for a long time. And you have to be honest. When we talked a little bit last time about systems change, one of the key challenges in doing system change is being willing to give something up that in and of itself is not being done what it's supposed to do. The system as a whole will still exist. Services for persons who are homeless, persons who live in food apartheid situations, services for people with chronic disease conditions, mental health conditions, so forth. Those are all general areas in which work will continue to be done. But the question is reassessing how those programs and services are working and making a commitment that if they need to be adjusted or changed or even discontinued, you're willing to do that. So that's why it's important in the decision-making process to do that. And then clarify the supports you have, particularly at the institution level, and really check in with your stakeholders. Most of y'all who work in agencies have advisory groups and have advisory persons. Make sure you check in with them and keep up to date. That's one of the real challenges, because you want to really push your advisors to be honest with you about what things are going. So this decision-making activities involve that. There's more. Really, really discuss the purpose, the meaning, and the implications of your development and planning process. So you should, on a regular basis, present to whomever it is who's going to be decision makers, here's what our program is. And I recommended, we talked about last time, anywhere between, every 3 years is a good means by which you assess things. Yearly is when you have to report it. But every 3 to 5 years, I should say, is when you really should take a hard look at your program. and then make a decision on the purpose and see in the meanings and how things are carrying out. And then you should clarify and restructure your goals, in your document, in your goals, your objectives, and your strategies, such that they are directly linked to this development and planning process and the tasks that you want to carry out with them. And make sure that they're consistent with how you vision, what your philosophy is. And in our terminology, your conceptual theoretical approach, but it really is your philosophy of why your program works. And the other way to say that is your practice model. What is it and how it is that influences how you practice what you do. Remember last time we talked about the fact that you have several programs or even several agencies or institutions that literally do the same work. They do mental health services for certain groups of people. They do HIV services for certain group of people. They do homeless work, food work. They do other types of health services work. And there's multiple institutions and agencies that do that. However, the practice model, why they do it, how they carry it out, those sort of things have a tendency to vary depending on who's running that program. So what you really need to make sure is that when you do the 3 to 5 year review and you do the replanning and you develop that DAP process, that you make sure that that practice model is consistent with the individuals, with the programs, institution, and then decide upon and define the questions you really want to answer. And what I mean by that is, now you need to really, in this part of really looking and deciding on developing either your initial part of your development and program process or your review, which is your 3 to 5 year review, decide on what it is you need to know and what is the questions are. And how you do that is you go back and look at why it is, what are the original goals and objectives, what it is that you felt that you've learned over that time. What is it that you've learned that you've both learned based on carrying the work out as planned or based on serendipity, things that ever come up, which they always do because of the programs and the way that we work and the communities you work, and or what others have advised you that you really need to consider, in this program. The one thing that I would just say at this part here that I think is really important is that if you do that, if you pull those things together and you work on that, what that allows you then to do is to be creative and innovative and going forward, and allows you then to look at resources or supports as well as service delivery elements that you may not have considered before. So determine the approach itself around your design, your data, and what you're going to look at. Make sure that you operational define, which what we mean by operational definitions is how do you make it measurable? So you define things. So how are you measuring service delivery? How are you measuring good outcomes? How are you measuring adequacy of participation of those that you've targeted? How are you measuring that? How are you operationally define what that will be? Is it that so many people are participating? Is it that you see changes physically in the persons you're working with? Is it that you've grown your network of collaborators, so on and so forth? It needs to be realistic, and it means these are your measurable parts. And we'll talk more about that in our evaluation, monitoring evaluation part. But it's really important to be thinking about this as you design your program, do program development. So decide on the final data collection focus you're going to have, your methods. For example, how are you going to collect information? Is it intake? Are you going to use your intake questionnaires to examine your population? Are you going to use medical records or with abstraction sheet? Are you going to look at some other secondary form of information, performance indicators saying, targets that you've said you're going to reach so many people over a certain period of time and so forth. So decide upon how you're going to pull your information together. And then it's really critical. So all of this is like ideal. This is how you would, if you designed a really good program and you were planning it right and you were doing what you need to do, these first 3 bullets is how stuff goes. However, we do not live in a perfect world. We live in a world where stuff changes all the time. So, but the strong advice is to make sure that you set up an alternative plan, a plan B. Most of you all know who work with us know we always have a plan B. There is stuff we we've set up and worked the way to go, but things happen. The weather happened, COVID happens, and it changes the world, and it changes how things are done. It changes how you approach things. So you should, as you are building into your development and planning, make sure that you develop, like, what if it doesn't go the way we want it to do? What is our plan B? Because you need to continue to provide services. You need to continue to support people. You need to continue to make sure resources are coming, and you need to be accountable to those that have given you support. So all that stuff is not going to stop just because other things that you're doing is interrupted for whatever reason. The life happens kind of thing. So have a plan B that allows you to do that. And the plan B is also an activity-based plan B, and a planning and response type of plan B. So what I mean by that is that a lot of times you have to make changes to the way that either your program, your services, or even your institutions works. And you have to be able to articulate that to your stakeholders. And so having a way that you're going to look at how to articulate that to your stakeholders is going to be very critically important. And particularly if you are looking at changing the way things are done, you're doing a systems change, and or you have stakeholders who you're encountering for the first time, or new programs you have for the first time, or programs that you've just gotten started, and you have multiple elements to that. You really do need to make sure that you articulate the challenges that you have. So paying attention to the challenges, having good information, and being able to interpret that information together, and having that discussion with this. This is why it is so important that you sit down with your team, and you can constantly work with your team to assess and have conversations about where you're going to go. And so set up these ongoing meetings with your team, document your lessons learned, in terms of how things have worked over the last 1 to 3 years, or 5 years. And then the ultimate goal in terms of making these activities work is to finalize decisions that help you to move your participants from this ideal that you have to what's realistic. Because that's kind of how we work. Let's admit, if we admit to ourselves, we really want to have an ideal approach to providing whatever groups and services and work that we do. Whatever programs we have, we want them to work in a certain way. And we have our ideas, we vision those ideas. But realistically, how is that going to make it work? So that's why you need to have a plan A and a plan B, because you have to move from what's ideal to real. And you accomplish this by taking into account what you have learned, your knowledge and your resources available, and the circumstances under which you've provided some assessment, be it monitoring and evaluation, or whatever activities that have occurred. So really keep that in mind. And so I would just say that in terms of decision-making activities, make sure that it's really clearly evidence-based. In other words, the evidence could be promising, stuff that you see that has a potential to work well, things that which are best practices that work well, things that you've proven, which are scientific practices. It's all blends together. However, it has to be done as leader. Your role as a leader is to bring together the folks that you need to be able to make these decisions, and then to be able to be in a position where you have enough of what you need to make good decisions. So move from what's ideally how it should work to realistically, and that will allow you in the long run, I should say, to sustain what it is you're trying to do. Programs burn out very, very quickly if you try to do an ideal thing and it doesn't work, and you don't have a plan on how to back that up. So it's very critical in your decision and your development and planning process that you have both a plan A and a plan B. And so that's part of your decision-making process. And so how do you do that then? Well, you do that with the next step. So let me pause there for a moment and see whether or not people have any comments or questions around decision-making and the activities around decision-making that so far we've discussed.
I do have, and I think you covered this a little bit, Dr. Telfair. I was thinking about, when we're working, especially in this climate that we're in right now, being in a place to be nimble enough to switch gears or to reimagine the work that we're doing, and then the importance of documenting that work. And it feels like we need to say a little bit more about that. So I'm kind of leading into the question about documenting the change and then what that would look like from your perspective. So did that make sense?
I do. I get what you're saying. So one of the things that we really, really push and then try to get people to do, and this is a little bit more, I don't know if I'm going to discuss it this time around, but I'll repeat it. So just let people know, we're just probably going to repeat it in the next stage. It is really critically important that, you generally make log notes and those type of things for the work that you do. It's to have a template, that is consistent, that you have a template. So in other words, then you have a log sheet that has categories of information that you think are consistently important, that are linked to the goals, objectives of that program and or the work you're going to do. So having one where you are able to align the process, which is what Ms. Roberts is talking about, the process of the work along with that, and also allow that to account for the changes that might occur, what changes that you anticipate, and then changes that just happen, that come up out of the blue. A lot of times, for example, and I'll use the COVID as an example. Most of us would say that it makes all the sense in the world that we would go out and get vaccinated against a pending threat that can cause really great harm. And if we have an effective tool for that, which is vaccination, we should definitely adapt that tool and use that tool. And, particularly if it's a personal adaptation in a way that we protect ourselves. Most of us agree on that, but then there's still a number of persons who don't agree for all kinds of reasons, be it very practical ones and be it ones we just don't understand. Well, but those are our constituents, those are our stakeholders, those are people we work with. So that means that we have to document, both the work that we have done and then the information that we're gathering, and then be able to go back and forth to be able to make decisions about how best to proceed. If we know that we've not reached a level in which persons we're working with are vaccinated or have a high level of vaccination, and that prevents us from doing our job, the way that we think it should be, then we need to have a plan B on how we're going to work with that group and deal with our own issues and challenges. So documenting that and sharing that in your teams, in your groups, is going to be important. And you as leaders, it's even more critically important that you really make sure that those who you are responsible for or who report to you have some means by which they're documenting these interchanges and work. We are fortunate in the sense that we've dealt with this COVID situation for a good while. We didn't see we knew based on science that the variant would come, because that's what happens when you have a virus, is that there are always going to be variants. And so we did not know the variants of that Delta situation, the virulence of it, but now we do. And so we now need to push for that. So the idea here is that in your planning, and we talked about this before, have a semi-permeable design. Have a design that allows for some flexibility. But the way you make decisions about flexibility is that you make sure that you have clear documentation that is a regular part of what you do. Because if you are in charge of persons who they're in charge of services, then you know that they have to document their progress in their work. Well, build into that as part of your planning a template on what it is you would normally collect, and then additional information as you do this, and regularly review that as part of that process. So Ms. Roberts, that's what I would recommend. And we do talk about that, and even give you a means by which to structure that and measure that when we talk about next go around in the spring. But it's good to be thinking about this now. I agree with you. Does that make sense? Answer your question? Okay, thank you. So focusing your program. So this is perfect. It leads into that. Now, focusing your program is pretty simple. I'm not going to spend a huge amount of time on this because I've said some of this already, but really make sure that you're very clear about the purpose of the program and the reason for its existence. And as I mentioned before, there are many programs that are similar, and the reason for why they exist is in general a lot of commonalities, but there may be very different. Some of it may be very personal, some of it may be very bureaucratic or political. You never know. And then some of it may be solely based upon express needs of those that you're targeting. You don't know that, but you don't know that, but you need to be clear about it, and you need to, before even progressing in the program, clear about it and why you exist in the first place, and constantly revisit that. That's what, if I could say anything about it, don't forget the history. Why does something exist? You should not forget that, and keep that and remind yourself on a regular basis. You as a leader, remind yourself. You remind your folks you work with on that one, and tie that into the philosophy of practice, your theory or your philosophy of practice. Your philosophy of practice, remember we talked about that earlier, is in the program way, is that what is it about the way you do the work you do of your service or your program that guides and provides direction for how you do it, how you carry out your work, and how you do the other bits, the logistics, the administrative coordination, that sort of thing. But this is called philosophy of practice, and it's really consistent with your purpose, but it's the hands-on part. It's the part where you are carrying out the activities of the service or the program, and it guides, what it is that you're trying to do, and it provides that direction. So keep that in mind. And your goal overall, or your goal is going to be your ultimate purpose, of the program. Why, tying all this together, ultimately, what is it that you want to accomplish, in the long run for the program itself? The objectives of the program, are going to be the things that you measure, and then the populations that you have, are going to be careful, think about carefully. Now, the thing about that, when possible, your target population, must be defined narrow and narrowly and homogeneously based on characteristics. Now, what do I mean by that? So it may seem like a contradiction to say be narrow, but also be homogeneous. Well, what I mean by that is that think about your population. So for example, you serve homeless population, and your overall target are homeless persons. Well, homeless persons, will historically, the growth in that population in terms of the demographics have shifted over the years from men mostly to now families. And so that means you're still serving as your target population persons who are homeless and feeding them, but you also now have to add in the element that you're dealing with families and all the dynamics that you need to consider when you're also serving families. You're still going to serve individuals, either individual men or women, but now you're going to also have to consider families that are mostly single persons, single women-led situations, or even single men-led situations. You don't know. So that means narrowly focusing on homelessness, but at the same time recognizing that there's going to be within group differences, and they're going to be within group part. So let me repeat that. Define your population carefully, thinking about who you're going to serve. If it's homeless persons, yes. Now, that's your narrowly group, but also recognize that within the homeless population, you're going to have a variation in the persons who need services. So that means that you're going to not just focus on housing and food. Now you're going to have to focus on things like, for families, you're going to things like schooling, like clothing, care and other things. So it's critically important that you make sure that the milestones, things you assess for your goal, that you keep that in there, and then ask who's the program really designed to reach. So if you think about what I'm saying, that is what I'm saying. Ask yourself as a leader, ask the persons who work with you, and then ask the population, is it really serving this? And do we need to make this? So remember, I said before that as you do your assessment and your development and planning, and you go back, you may have to rethink how you design a program. Because if your program was just designed to serve individuals, and now you're seeing a real growth in your population, and this happens particularly in this region, where we're seeing in many of the services we have is designed to speak to serve people who are local. Well, because we have a growing international population, we have a growing population that speaks multiple languages, has multiple cultures, and so forth. We now have to think about diversification, and the levels of diversification, and are we really addressing that in an adequate way? It's not enough to just have diversity look based on race. We also now have to think about it in terms of language, in terms of country of origin, sexual orientation, pairings, family members, and so forth. So keep in mind that defining carefully means being able to make sure that your focus is just according to what you have. And I'll say a little bit more about that. So defining the program task. So what it is that you're doing, this needs to be carried out, and it needs to be written out. It needs to be clearly stated. You need to have a means to measure that. It needs to have a time frame, of when these things are going to occur. Now, given the fact that you also have to account for when you have to make these spur of the moment pivots, like we just had to make with COVID. We historically dealing with outbreaks of disease, most of us are very accustomed to that. We have a plan, it's worked out, and we have these emergency plans that's already done. These service plans, these emergency plans, a catastrophic plans, we have all those. But we had to really do a major adjustments to those plans because COVID threw a wrench in the way that we normally do things. And I mean normal, and I'm using quotes to say normal, because if we're in a situation now where everything there's not going to be, or at least normal has to be redefined. So that means that think of those plans that has to be written and the adjustments that you have to make. And we are fortunate to have a strong, and I'll say this again, strong group of folks who are very competent, who are very skilled and knowledgeable, and allowed us to make those pivots and those adjustments. But we still are making the pivots and the adjustments because these things are changing fairly regularly. And we know that the stability that we normally are accustomed to in some ways is not there. But we also know that that is our reality. As people who work with different communities, we know that the one constant about communities is that they change. And sometimes they change slowly, and sometimes they change rapidly. And so part of defining our program task is writing out and giving ourselves room, plan A, plan B. So building an understanding and support for planning needs to be done by everybody involved. And I have this bullet list: administrators, staff, funders, clients, and other key stakeholders. Very, very critical to this. So focusing your program, let me just wrap this up, requires that you're clear about the goals, about the objectives, about the purpose, and about why you exist. It also means making sure that your program is set in such a way that it's able to adapt to the changes that are going to happen. So the big other thing there is be anticipatory. Know that their change is going to happen, and know that work needs to be done. We have, for us who work in this arena, there's really no such thing as business as usual. There's life and there's business, but it's not usual. And so we have to learn how to adapt and adjust accordingly and build that into focus of your program. So, and that needs to be something that you have it. So what I would say here is that you need to build the understanding and support. That is something that takes time to do. But as a leader, it's important that you have that you're doing this, that you're consistently making sure that those who are involved at whatever level, that there's good communication, there's consistent levels of agreement as best you can have them. Not everybody's going to agree on everything. And there's means by which you're planning and you're leaving room to deal with contingencies that might occur. And that becomes the culture of how you work. That becomes the standard of how you work. So it's not another on that one. So that means that your group should be accustomed to having to carry out work as they can and or making adjustments. So you as a leader have that responsibility, either through your management work, your administrative work, and so forth, to make sure that you built a culture that allows for adaptation, change, and that thing. So that's also a key part of that. So before I leave this section, I want you to keep that in mind. All right, so let's talk then about what is it that you need for the program to do what it is we just discussed. So this is a basic elements of a development and planning systems framework. This is the kind of stuff that if you put together structure, for example, strategic planning work, that sort of thing, this is what goes into that. Now, some of you who do assessment will also recognize that this is what goes also into a traditional logic model, plan. These are all the key words and key terms that goes into that. And it's slightly different here, but part of that. So the framework, what that allows you to do is provide some structure to what it is that you're going to move forward and what it is you're going to plan to do. And again, I would remind you that the structure, while it's good and while it's organized, and if you're like me, and your OCD kicks in on a regular basis, then you want to have that kind of structure. But at the same time, you have to also realize that you're going to have to be able to make adaptations and make changes that occur that allows you to do the work. So keep that in mind, and that's really important. All right, then. So the first part is input. So what is it that you have there? And it's your clients, the staff, materials, and resources. Think about that as part of the planning. Think about the process, whether it's an intervention or whether it's a program with services, and then what are you going to output? So what are the things you're going to need to keep the program going, and what it is going to be the end of the day, your products, what you're trying to do. So how did your clients either receive or complete services, for example? And then outcomes, which are just measurable change. They could be whatever way you decide you want to measure the program itself, be it numerical, be it some kind of standardized measure, be it some kind of written measure where you've discussed. You have this. Remember, I was suggesting to you put together your notes in a template, and then review that template on a regular basis, and that kind of work. Yes, that's something that we learned in social work school. Our SOAP notes, our strategic notes, and that allowed us then to have really good conversation and to make good decisions. The other thing is that level of functioning, which is your performance measures. How is your program working? This is good for both the short and the long run. It allows you to figure out what you're going to do. And then, of course, feedback, from your constituents. It could be client satisfaction. It could be your board, review board. It could be the people that you are partnering with in your other agencies that you're partnering with, and so forth. Whatever it is, these outcomes, you really are the things that you use to move forward. All right, so let's kind of break this down a little bit in a way that makes sense. So now, document program service components. And this is what you would do. And this is something that you as a leader would be mostly responsible for. You'd have someone who is your assessment person and or your document person. And if it's you, it may be you that has to make the notes and do the reporting. And so what are your components that you have to make sure you pay attention to? Well, outcome objectives that you need to address. What is it that that you say you're going to put in a time frame, you're going to measure, and you're going to make sense of. Define and identify your group, and we mentioned this before, just knowing that you're going to have to make some adjustments at times. The group you started out with, may look different in year one, may look slightly different in year two. And it doesn't matter, it doesn't matter you know, if the way that you received your supports targeted the group the way that you defined them in year one, because it's your role, and it's a sort of it's an expectation. It may be a stated one, or it may be an implied one, or maybe just an understated one, that you would be the one keeping up your supports and your resources about the changes of your population. So if you have a behavioral health program, and your behavioral program is targeted to adolescents, and it's targeted to both male and female adolescents, well, yeah, that's the group. But then what happens when you start seeing adolescents, you know, who have chronic, you know, physical conditions, who now become a part of your service population? That may not have been your consideration when you started the support, but now it is, because this group is growing. You know, large numbers of young persons with diabetes, with other types of, you know, chronic disease and so forth. And then those that also, your mental health group is going to be those that have acute mental health issues as opposed to chronic mental health issues and so forth. So be aware of that, and be sure that the principal activities or service you provide are really consistent with what it is you're trying to do. The other key thing, and this was been mentioned over and over again, one of the things that happens with a program, it really can put a monkey wrench in the way a program works, is if you don't really screen well the persons who are staffing the program itself, and whether they have requisite skills or not. Because a lot of times volunteers, you don't really, and if a big piece of your program is volunteers, that's a toughie, because you don't want to turn people away because they're just good-hearted and they want to work with you. You as a leader have to make a decision on how you utilize your volunteers. That's what program planning would be. So they're going to be volunteers that actually have very specific knowledge and skill sets that you can sort of shift over into certain arenas. And then there's those that are just there because they want to hand out, they want to help hand out food, they want to sit down and hold a person's hand, you know, that kind of stuff. Well, yeah, those are all good. But what we're saying with staffing here and your planning process is to make sure that you even with volunteers, you screen them well, you know, as best you can, and to place them well in the areas in which they where you think they could be utilized the best. And it goes without saying to make sure that you screen out persons, you know, who would not be helpful in your program. I won't go into that so much, but you as a leader, you really should to make sure that you have people that are going to be, and I can use the word safe, who's working with your program. No matter what your program is, you need to have safe people. The other part is that special resources to keep your program going is going to be very critical. And it's very critical because you have to pay attention to how those resources are used to your program. And what do I mean by that? Well, what I mean is that make sure that whatever resources you have is going to be specific to the program setting or location, the type of and duration of the service going to be provided, the type of documentation, you know, you need to understand how programs are linked to indicators. In other words, how services are carried out. So are you reaching your target of 100 persons? But 100 persons are the appropriate 100, or they're just the 100 that reached out to or not? The other part of targeting to make sure your resources work is that it's going to be based on implementation. So how you carry the work out. If you go back to the staffing part of this, the staffing is going to play a major role in the bullet number 4, which is the amount of progress you make based on implementation of services to tasks. You got to make sure, and this is the last bullet here, the person's responsible for implementation overall in the program are everything. And I will use the word fit. If you think about it, who are the best fit to make sure that the program is carried out the way it does? Determining the components of your program requires that you think about the fit issue. So the amount of work and progress you're going to make, as well as responsibilities, has a lot to do with decisions you're going to make in terms of the resources that you have, and then how those resources are used, particularly your staffing and your personnel resources. It's tough as a leader to do that work, particularly if you're in a busy service. You have a busy program and a busy service. That's true. but that's where you also do delegation. And you really got to admit to yourself many times, yes, you are strong, you are you are knowledgeable, you're skilled and so forth, but you are an individual and you only have so much time, so much effort. You can only pay attention to so many things. This is why you have people work with you who can also take on leadership and some of these responsibilities. And so the part of here that's not on the list here, but I really want to emphasize this, is that delegation, negotiated delegation. In other words, persons who are you're going to ask to provide leadership for, making sure that you negotiate with them, that they're willing to take that responsibility, they can take that responsibility, they have the skill set and the temperament to take that responsibility. You have that work out and you oversee them to make sure that's carried out. And if it's not working the way you should, or leadership's not working where you should, or if someone says, oh, so the person who's leading this is we're just having a challenge working with them, you're going to have to prepare yourself. You should prepare yourself, I should say, to be willing to work with that person, either to bring them up to speed or to address whatever that challenge is, or to move them out and move someone else in. Those are leadership skills. How do you deal with that? So when you're looking at service components and you're looking at carrying things out, know that the other leadership skills you're going to have to put in place in terms of this, making hard decisions, making this decision, whether it's how to expend funds, how to move personnel around, or even how to work with stakeholders or clients. All of those things are part of the decision-making and the work you're going to have to do in the planning for this part. It's hard to leave on that note, but I want to do this. So think about this. And I'll pause for a moment to see if you have any comments there before I move to the other key area. Okay, so let's move. All right, so talking about developing a program plan. So there's elements to this. So remember, let me go back to what I have here. That you have a framework, right? That in which you are making, of the systems framework that you have, of putting things together in such a way that now, these are the process and how it's going to work. So this is the systems framework. This is the overarching approach and overarching elements that you really need to pay attention to. But what I want to talk about in this next section is actually the plan for that. And so there are components to that and elements to that that you really need to understand. So it's one thing to have the structure of the overall framework. It's another thing to understand how do they interact, how they work together. So what I want to talk about is now how they work together. So we've talked about the inputs, the outputs, the process, the throughputs, and then the outcomes. We've talked about that. So how does all those things work together? So it's important to understand the importance here. So the internal consistency and integrity. Key to having programs that are both successful, long-lasting, and that pretty much your stakeholders agree, this is what we should be paying attention to, are these two things. The ability to be consistent and to have integrity. And integrity, as you know, means things like trust. People can honestly rely on whatever it is that your program is doing. Honestly say that they have confidence in this program and its work. That is one of right now in the element in which we live. That's where, particularly with the COVID situation, we are having some challenges. We're having challenges that people are questioning and not so much the consistency of what we do, but the integrity of what we do. So that means that we really have to up our game to make sure that this is pretty constant, this is known. do this. And the way that we do that, of course, is that we are just consistent. We are just making sure that we deal with this and that we're honest about the trust issues and we're honest about ways to do that. Now, fortunately, for most of y'all on this call, dealing with honestly with your constituents is what you do already, and it's just a reminder about that. And this is just something you've heard. But I would just say, as many of us who've done this a long time, don't assume, just because they trust you on one thing, they're going to trust you on something else. You're going to have to, like, particularly when new challenges emerge, it's going to be important for you to reestablish that trust in that particular area. Because why is that? Because a lot of times, many of us know the story. People know us by certain things that we do and certain skills they know we have and so forth. But when something new and different comes up, they may not associate, what we know, our ability to take care of them or take care of the work with that new challenge. And so we have to do the reestablishment bit. So I would just say, be honest and, about that, and make sure that you pay attention and you focus on being consistent and have a high degree of integrity and confidence, because that confidence itself is so critical to you and carrying out the elements of your program. And to ask yourself, when you carry this program out, is it logical? Does it make sense? Can it be implemented the way that we said it can be, and can it be assessed the way we said it can be? So why are we asking this? Well, because it goes back to what we said earlier. Purpose of the program design is understanding the needs and the design, the interventions you're going to need to meet whatever the service is going to be. That means you need to put them together in some combination where they make sense. Again, we're moving to talking about relationships. So you have a program. Your program is designed to provide HIV services. Now, it's an HIV service program that's designed to meet the needs of certain populations of, say, Latinos, who they're adult Latino males. Okay, so that's the group you're reaching. Within that group, they're going to be some divergency between people who have different orientations, and also levels of language, levels of culture, levels of things like that. So it's important that you also know how the program that, and then what are the services? Do you need to just have you have an overarching program, but within those, are there special services you might need to meet the unique needs of that group? And they're going to be unique needs. So putting those together and make sure that they make sense, such that when you discuss the program overall, that these services feed that. So it's not that you have an overarching program that has services linked to them. And those services linked to them, it is not a unilateral way of going. It's a bilateral way. It's a back and forth. So the services are provided, but feedback from those services to the program means it tells you whether you need to do program change, service change, those sort of things. So that back and forth combination in the relationship needs to be a dynamic one. So putting together services, combination of services to best achieve what your program objectives are means that you have to make sure that that back and forth is going on. And if you have a unique population, like Latino males, there's going to be some challenges. So be anticipatory. So specific elements of the program, then consider careful analysis and attention to the detail of the programs. Develop a series of programs and service questions that you're constantly asking, yourselves and each other. And that should be part of your design. That should be part of your program design. You should have built into that, just like we said before, when you're keeping notes about services being delivered and how you're looking at those services, what is it that? And the more straightforward way to do this is to think about what are you saying is success? What tells you that a program and or services are successful? What have you to make that? What is that decision, and how do you have that decision? And the critical piece, of course, is there agreement that what you are defining as success is shared by those who are the stakeholders, as well as the staff as well as other administrators, as well as your support persons. So is there this sort of global agreement of what success looks like? And I say that because that is not easy, right? Success is sometimes in the eye of the beholder, but the way that we're not allowed that luxury in our programs. We have to be very clear and document what we mean by success. We have to make sure that that success is a shared idea, particularly if you're thinking about the next things we're going to talk about, which is setting boundaries, for implementation of the program. And so how do you do that and think of that? So identify, rewrite the program goals and objectives and make them measurable, and developing the plan itself. Identify implementation guidelines, which I'm going to talk about in the next slide, and discuss, or record, as we have talked about before, what is the philosophy of practice? What is your theory of practice? How are you going to things to be carried out? And then make sure that you clearly outline the services themselves. So if you need a template for what to write and what to record, these are multiple elements. And a little bit more is make sure you develop a description of what is implementation and intervention questions. In other words, what is your success guideline? So you have a philosophy of practice, how things are going to be carried out the way that you think they should be carried out, or how are you going to approach them. But you also need to make sure you do that and then document, understanding the agreement of those things before. And the best way to really be responsive to those who are involved in your effort is to have very clear, as I said before, documentation that is levels of agreement. So if you're going to start a program, or even you're going to continue a program, it is crucial that you go back and you really say, are we keeping track of, are we documenting, and are we discussing the things that we need to do, the things we need to discuss, the work that we need to do? And so it's very, very critical that you continue to do that. And so that's why I mentioned over and over again, documentation. And so the other part that I want to say here is then determine and document agreement for what information you're going to have and how you're going to do that. But the other piece, though, is outline for all those involved, administrators, staff, clients, and other stakeholders, what is it that are going to be, what you're going to do, and determine, what budget you have available. Now, what I'm saying here, and I'm going to go back a slide or two. So what I mean by boundaries of implementation means that what is it that you see you can realistically do? And that is a big decision to make. And what I've outlined for you in these three slides are the decision making that you have to go into that, because a program that exists, despite what you would like to do, what can you realistically do? And I will remind you over and over again, it's important. You need to set, and it's important that you set boundaries for your program, because you can only do so much. Overpromising leads to what I was talking about before, which is the lack of consistency and a lack of integrity. If you overpromise, and that is the way things go, and you develop very quickly a reputation for that, not being able to carry things out you promised you would, that's a real challenge. And so I would just say it's very important to work on an approach that, as you develop your program plan, you make sure that you develop it in an incremental way. Now, this does not negate the fact that many of you are highly skilled and you've done this for a long time. I agree. You know this already. However, one of the things that we who have been doing this for a long time, we get caught up in the fact that we're good at what we do, right? And we forget that every once in a while we need to practice culture of humility and make it and realize that, yeah, we're good at what we do, but we can still lose track of what it is we're trying to do and those that we're working with and so forth. And so it's really good to have checks, be it by your staff, by yourself, do that. Doing self-assessment as a leader is really sound thing. And I'm sure you all who took leadership training know have that has been said to you. Self-assess. You, not just your program, not just the work you do or your institution, but yourself is a very critical piece here. And doing that with your program, setting boundaries allows you to move in an incremental way. It also is so important to be able to work with your resources, work with sustainment, and keep you there in the long run. If you look at programs that have been around a long time, even your own, you know that they've grown because they were able to set realistic boundaries around what it is that they can and cannot do, who they work with, who they serve, and so forth. So that's what these 3 slides I'm talking about in terms of planning is to be realistic around the boundaries of your program and about the efforts itself. And then determine all these efforts. And these are just the considerations that I've listed to you in these 3 slides. I don't know if you have any comments on that.
Hey, Dr. Telfair, I think for me, part of that is self-assessment of ourselves, is our ability to see ourselves in the work and outside of the work, and then make corrections, because that double loop learning part in leadership is so critical for our development.
Great.
And so it's like putting a challenge out to all of us to self-assess and to think about how we see ourselves in the work and outside of the work. And then I think for me, the next piece that's pretty critical in this, not critical as in criticize, but critical as in vital, is regarding this play, and it's to me can be a very fine point of when our organizations get into mission creep, and knowing when that's going to happen, and knowing at what point do we reinvent ourselves, or do we stay the course when we know that there's a lot of change in happening just in real time, just within our own communities. So I wonder what you would say about that. And because I think it is a very fine line. We know what our mission is of our organizations, and straying off of that too far is pretty dangerous. And yet there are times when we need to adapt to meet a growing need in the community. So I'll leave it there, because it's, I think we all see it at different points, and where we might, where there might be a opportunity for growth that could still align with mission.
Well, one of the things I understand, I hear you loud and clear. So let me say maybe 1 or 2 or more things. So first of all, it's really critical that as you are making decisions about the work of your program, that you stick to, as close as you can, a timeline for self-reflection, that you think about that you don't get so far out into doing the work and carrying the work out that you forget that you have to take a step back and self-reflect. I would say that also should be a decision you make when you're thinking about, the growth of the program. So for example, I use the one about working with homeless populations. Those that worked in homeless populations, and I know there's probably someone on here, will know that the homeless population demographics have changed, historically have changed. And they're moving more into where you have more families and other groups. Whether you saw that coming or not is another thing. But a lot of these homeless programs were not designed that way. The newer ones were, but the ones that have been around a long time have not. And they've had a bit of a challenge adapting to that. So they've added new programs and other kinds of things. That's really good. But however, one of the things that can happen though is that you can kind of lose sight of the kinds of inputs that you need to make good decisions for that kind of growth. So being humble about listening to those that you either are planning the services for and or new folks that you work with to make sure that you are checking in and asking yourself, are we intended for this to happen this way, but is it working out this way? And be willing to make those adjustments, as needed for that program or not. The other part of it is to avoid mission creep, means to make sure that you are constantly checking the boundaries of around the program work itself. Otherwise, you can easily get lost because it's what we do. I mean, a big piece of leadership is to really be, is not to be so objective that we forget that we have subjective feelings and other things go on. We could easily, because people will come to us and ask us for support on how to do that. But be strategic, be clear, of what it is you can do, and be humble enough to want to delegate that. The other way to do that, of course, is not to do the assumption, and this is a critical thing that I would just say here, is because that's something we all got to remind ourselves regularly, is that, yeah, we're good at what we do, but we are not the only ones that are good at what we do. There are others out there who we could work with. And so the analogy is that when you're making this, you're working there, you work not at a square table or rectangular table, you work at a round table. At any point in the round table, someone is a better leader or better decision-making on a particular issue that you're all dealing with than others. And you all work that way to a certain degree already, which is really good. A lot of folks don't. But to avoid overstretching yourself, that's kind of the way to do that. And make sure that you check in with each other, to make sure that happens. And most of it is just, when you're being anticipatory, not be reactive, but responsive and anticipatory. Think about, that when you're sitting there and you're going through, like what Ms. Roberts does when you're looking at your plan, a plan and the work that you do for your agency. Take a step back and think about what's changed, what's the same, what are things you're going to do, and then move in that direction. So that's the other bit I would say to that. I don't know if there's any other comments before I move forward. No questions. Dr. Smalls.
Just a quick comment, again, this in terms of this self-reflection as a leader, I think an important part, and you mentioned it, Dr. Telford, already, in terms of getting staff input, being courageous enough to be able to receive feedback from your staff and those that are around you, are working with you in this program implementation. So it's sort of like while you're developing your program to serve the external stakeholders, if you will, that you're also building internally a culture where people feel safe and people feel that it is that you want to hear their feedback. And because, like you said, that round table where everyone is sitting around discussing whatever's going on, the people that you've put around that are part of that table, hopefully you brought them there because you trust them and you thought that they had some skills and abilities that would help you to move this program, the organization along. And so along with that, you have to be open and willing as a leader to hear what they have to say that may not always be agreeable with what direction you want to move in, but be open to that and in creating that culture. And sometimes in leadership, in terms of how sometimes leadership is taught, the thought about what leadership is, people don't think that you have to be open to that, but that's not at all the case. In order to be an effective leader, you really have to be courageous enough to hear from everyone in all different aspects, in a respectful and professional way, of course.
Of course, I would 100% agree. Leader as servant and cultural humility practice. Yes, ma'am, I agree. Others, anybody else?
To go off of what she just said, I think I completely agree. It's just being open to anybody and having that culture of like, you can say whatever you need to say and it be constructive and not taken in a personal way. And that's what I was thinking when you were talking about self-assessment. And I was thinking to myself, I was like, gosh, I've never self-assessed my leadership. You know, I don't know if I'm in that space where that, not that necessarily I don't think I'm a leader, so it's more of I've always just considered myself a servant and not really, you know, guiding within like staff. But it's just interesting to me is that I was thinking of questions like, how can I self-assess? And I always look for outside opinions. And so that's what I think I appreciate you saying that, just because I would rather others tell me, you know, oh, I think this way is better or that way is better, because I'm doing it the way that I think is right. But how do I know if it's right or wrong? Because I have a hard time self-assessing, I guess, without input from the outside. So I appreciate that, because that's what I was thinking. I was like, I'd rather someone tell me, you know, how I'm doing than me keep going on and doing what I'm doing. So
Yeah.
I appreciate you saying that.
Yeah, yeah. And do you think that those that you are working with, whether independent of what level you are, high level, not level, whatever, they are actually looking to you to make decisions though, right?
They are, yeah. I guess it's just for me when I'm doing my programs, I'm not really thinking like, oh, I'm a leader or a community leader. I'm more of just being a servant to the needs of the community is kind of how I've always seen it. So it's just interesting to think about it that way, and then like a self-assess, like, oh, well, I am a leader to it instead of just a sideline, you know, because I've always been the stay in line with everybody, and like, you know, you can lead within the group instead of being the head of the group.
Yeah.
So I like the group aspect of it, is in saying like, you know, we're all leaders in the same aspect. Is like, how are we leading differently within the group?
Yeah, yeah, agree. Okay.
Can I make
Yeah.
a
Right.
comment? I just want to, so Laura, what you're doing right now is self-assessing yourself.
You're right. You're right.
So the other piece I want to just say to you is that it took a lot of vulnerability for you to say what you just said, which, by the way, is one of the greatest strengths of leaders. When we allow ourselves to be vulnerable and say that we don't know something and that we're trying to that's a great strength of a leader. So what you were doing just now is assess, you were seeing yourself. So when I mentioned double loop learning, that's when we get to a place where we are able to see ourselves in the moment of something and self-correct in that moment. Does that make sense?
Yeah, it does. Thanks. See, this is the group input that we need. Thank
Yeah.
you.
Okay, thank you. All right, so let's see. So I'm gonna just talk a little bit about methodology, but I want to just pay attention to certain things because I'm going to repeat this. But anyway, so attention based on the discussion we've just had, which I think is really important, is paying attention to the implementation of the program, particularly what we've just shared, the context, the outcomes. But then, you know, think about the, you know, how you're observing the program and the task. So pay attention to how you're doing this. And in monitoring and evaluation, when we talk about that, we're going to pay a lot of attention to that. So essentially, I'm just sort of giving you a preamble to the stuff we're going to talk about in monitoring and evaluation, but a logistical plan is really critical. So this is a piece where when you're developing your program plan, think about logistics or your action plan, if you will. And think about, you know, what will enable the staff to complete the work itself and the things that you're trying to do, yourself and the staff. So if you're overseeing your programs and you're making sure your services are being carried out, then you have some kind of, you know, action plan or logical plan or logical model, you know, that allows you to make sure that the scheduling is where it can, the parameters are in place, and that, the planning process is addressing some of the more, if you, thorny issues like political issues, technical issues, and interpersonal. So remember that the way that, that you look at a project and a program is that it's not solely service delivery. It has these other elements. It's partly political, it's partly technical, and it's definitely partly interpersonal or social. And we talk about this, we talk about it, but not in those words when we're sitting this. When we're talking about, like, for example, asking questions about the situation or the context in which we currently live. Well, we're talking about the political context. Being able to carry things out the way they should and making sure we're paying attention to that is technical. Making sure that we do what we just talked about a little bit here is self-assessment, us as leaders as well as programs. Those are interpersonal and partial. So this implies as a manager or as a leader, particularly a leader as a servant, where you really paid attention to making sure you are yourself being looked upon, because you're as a leader, you're ascribed a certain degree of authority and power. And it's what Dr. Small's referring to, alluding to, I should say, is the sharing of that power. And how you share that power has a lot to do with that. So a participatory management style is a way that you share that power. And because yes, you are the designated person in charge. However, it also means that you're listening, as was just shared from our colleague from the Y, and you're paying attention to what people are saying, but you're still the one that you're looking to work these. So that implies that, as you said, as was said, make sure that there are common goals, and make sure that the common goals are in an environment where people have a level of comfort to reinforce those goals, to feel like they're carrying those goals out, to question those goals and so forth, but there must be common. And a rational decision-making model and a rational model means one that where the decisions that are made make sense and that they're consistent with what it is that you're trying to carry out, right? And if you have to sort of deviate from the plan, if you will, that deviation itself is not seen as unusual. It's seen as an alternative that would allow you to still carry out the common goals. And it's an alternative that has as much participatory aspects of it as you can, and that it allows for willingness to change. Now, let me say something about participatory management that I think is really important. Participatory management does not mean that you yourself as a leader do not have to make hard decisions, because there are going to be times when you have to just make a call. Independent of what people are telling you, you got to make a call because the situation calls for that. However, if the environment that you've created has enough, you've created a trusting environment where people know that every once in a while that has to be done, that's the case. And that's generally around issues like political issues, technical issues, or interpersonal issues. And the interpersonal issue has a lot to do with like personnel and other things. The political issue is going to be like laws that make no sense, but they have to be carried out. And they're going to rely on you to provide some guidance on how to carry out those rules, whether those rules make sense or not. And the technical part is when stuff is just not working the way it should. And you have to make a call, like you have to either, drop a program or drop a service, something like that. Those are all part of the planning process. Those are all part of the things you have to be able to make sure that you do. So creating the environment where you can honestly have these decisions, and as Dr. Small says, whether you're in it where there's going to be those where you agree or disagree, technical issues and interpersonal issues, those are all critical to the process. And that implies these 4 areas in which I've mentioned. So I want to leave the planning group process there and move on to the next bit. And I'll see if you have any other comments on that end. All right, so I'm gonna pause for a moment. I need to check the agenda, if you will. Excuse me for a second. I'm gonna have to pause for a moment and check my agenda. Sorry. Okay. I'm back. All right, so I just wanted to just check where my timing is here. Okay, so the other thing to keep in mind is going to be implementation, how you carry these things out. So just keep in mind that program development and planning does not proceed, produce like permanent solutions. So in other words, then, and I've said this before, and I want to do this as a reminder. So the environment, the environment, whether it's social, physical environment, changes as you plan. And the environment changes because we change, we ourselves, this one. One of the things are, and many of you know this, and I'm sure you could attest, a lot of times, and this is your situation, particularly with Healthy Savannah, if you work at Healthy Savannah, it may be slightly different. But in a lot of situations, those who design the actual program, itself, or not always the people who are the ones given the responsibility of carrying it out. And a number of you are on projects like that, where, a number of you are on projects like that, so when we're discussing implementation, let's see, back to this. So when we're discussing implementation, the situation in which the decision initially was made on this one. So the first bullet here is as we had planned. The second one is because we change. In other words, then the personnel changes, the emphasis area changes, and so forth. So that means that no planning model fully reflects the complexity of real world. We live in a complex world. Our area in which we work, this word defines it very well, which is complexity. So that means that the planning process does enhance decision-making. What it allows you to do, which is why we do this in the first place, is define what your problem or your challenge is. It makes sure that it really looks at testing assumptions or philosophies of practice, or philosophies of why people participate with you in the first place, and in perceptions of the program itself. And it generates a debate about solutions, but it also can democratize and be inclusive and can be census building. And that's kind of what you want to lead to. So if you implement a really sound development and planning process, this is the things that go on during that process. This is the reality in which you work. And I want to emphasize that, is that this is what I mean when I say we live in a dynamic environment, and that the constant is that stuff changes. And whether or not you are able to successfully maneuver through or negotiate this has a lot to do with how well this part works, and how well you were able to define things, get participants to test their assumptions and their perceptions, really have a good and honest and open debate about how things will be resolved, and then make sure that there's a high level of comfort in those environments. And this is something you all do really well, better than most, which is democratizing, being inclusive, and having consensus building. So what does that mean? So that means that it must be implicit in the sense that you have an understanding. So one of the things that works really well, particularly as you as leader, is that people get to know who you are, get to know your leadership style and your approach. and they become to trust that leadership style and approach. And so that sometimes you do not always have to, say or explain everything, because of who you are and what they understand, they get who you are. That takes a while. But other times, in order to make sure that that is backed up, you have an explicit plan, which is a blueprint or rationale, and that you do this self-assessment or this fine-tuning. I like to think of self-assessment as this, which is fine-tuning, which is incremental. But before you can have this, which I think a lot of us work from this perspective, which is that you know me, so whatever decisions I make, trust me, we'll make it work. Well, yeah, most of the time that will work, but not always. Plus, because you live in a dynamic environment where people are coming in and out, where situations are in and out, where funders and supporters and clients are in and out. Yeah, those that have worked with you know you are fine, but majority of the time you're going to have something like this, where everything is spelled out. So your development and planning allows you to do this. Now, the context of the preventative planning needs to be really understood as well as structured in such a way that the overall organization, how it's going to be carried out, what supports fiscal and otherwise are there, and then what is going to be the climate, of decision making, the climate of rules, laws, and so forth that it exists in. And so let me repeat this again and kind of add this to that, because if this is what I said in the previous one, then what I'm saying here is how you spell it out. So the components of this plan allows you to do situational analyses. In other words, then, as I said before, there are going to be serendipitous situations where things just come up that you may not have anticipated. And so situationally, you should be able to have a good plan in place. How you're going to analyze that situation, draw conclusions from that situation, and then make decisions on how to move forward. You need to make sure that you establish a really good group of folks who can give you input on how to plan, and how to make adjustments to that plan if you can. Make sure that how you're defining the challenge or the problem issue itself starts with a good baseline understanding of it, and know that it changes over time. So what you're saying is that homelessness for persons living in your region itself, homelessness is clearly defined, but who homeless comes under that definition, the other sub definitions of who is homeless and who's not, and even the reasons why that's the case, and even the reason why you yourself in a program would provide services for that may really change. And then how does that affect health? How does that affect health? It's really a challenge to provide a consistent assessment, clinical care, or even having some kind of regimen to be followed if the persons do not have a good place to live. They do not have regular nutrition. They do not have regular means of sanitation and so forth. Yeah, it's really hard to develop a clinical intervention, that people can follow. So that, work is going to be there. So your needs assessment, as it needs to be, look at this. It needs to constantly looked at and constantly refined. Goals and objectives, we talked about that before. Make sure that they themselves need to be looked at, and identifying strategies, of how all this will be carried out, as well as how you're going to implement them, which is linked to those strategies, and of course, how you're going to assess that work itself. So what I'm suggesting then is information planning should include these things. Who's in charge? Assure that the authority, the person or persons who is over this are people who are in a position to make good decisions. Despite our best, and we have to be honest with ourselves, despite our best efforts, not all of us are in the best position to make decisions about every situation. And so we do have to practice cultural humility and admit that there are things we know and what we don't know. And that we have to reach out to have that, to have others work with us, delegate it. However, we need to make sure that that decision is clear and that we are making that as persons who are ultimately responsible for that. And so assuring authority is important, not only just for the people that you work with, and those that report to you, but also it's seen from those who are other stakeholders or even your clients, that sort of thing. Assigning roles, which is what I'm saying about delegation, is making sure that you really, again, going back to the staffing question, going back to delegation, who is best for that, and then overseeing that to make sure that people you thought would good at working in a particular role, taking a responsibility, that they still are capable of that, because stuff changes. They're human beings, things change, and or initially they may be able to handle something, and then life changes. And we've seen that in the last couple of years, how just the effects of having to do so much has really taken a toll on our ability, on our psyche, on our emotional well-being. And many of us had to step away and recharge and come back. And so that means that the roles that you assign them will have to be relooked at. So again, I would just say have a plan A, plan B on that. Allocate the resources that you need adequately. That's a toughie, because that's the same as developing your budget. You as a person who is in leadership, know that you have not only just financial resources and personnel resources, but you have other physical and partnership resources that you also have to really look at. And then how do you best use those in terms of the planning itself? And then assess when you decide that you're going to carry something out, test it out first. I am a big believer in pilot testing stuff. Reach out, try it out on a couple clients, try it out on a couple colleagues, ask people what they think, and then do that work. So once you've kind of established these first 5 bullets, then develop timelines and then a real work plan. And the work plan itself is one where you have stuff kind of laid out, both who's in, what the goals, what the objectives are, who's in charge, what's a timeline, for that, as well as how you're going to measure either proximal, intermediate, and then distal outcomes related to that. So again, the work plan should have the elements of goals, objectives, who's responsible, who's in charge, what resource is going to be available for that, how you're going to measure it, and then what the timeline is, and what are the outcomes you're going to look for. And then that all kind of goes into that. And then so you want to be able to answer a series of questions. And the series of questions are these: why are the outcomes to be achieved? Why? Why are the outcomes to be achieved? What are the activities that are required to achieve these objectives, or these outcomes? Who are the individuals responsible for each of these? The sequence of activities, the how you're going to carry out, which are going to be things like materials, supplies, technology, media, and so forth. You're going to do that. Where are you going to carry this out? Is the location going to be where your headquarters are, where your field, if it's in the field work, where it was the best place, what is a safe place? Where are people who are you targeting, the best place they're going to access your services, and so forth. And then what is the cost and what is the work's going to be? And also set up critically, as you're thinking about implementation, set up as one of your major steps a feedback loop. And the feedback loop itself is going to be how to tell you activities are happening as they should. So your inputs, your throughputs, outcomes, outputs, and outcomes. So this is kind of where it goes. And I have this as a feedback going from your left to right, but it also left to right also is a way to have feedback that the feedback is used. So that's why the arrow goes on the other side as well, is how you're going to use that. And then when we talk about monitoring and evaluation, we'll cover that part. Now, the other thing about implementation, is clearly state and assign who's going to be responsible for what. And assign responsibility for activities to ensure that everything or the coordination is going to be carried out the way it should. And clearly set your preparatory steps. In other words, be prepared, be your things that are going to start the program and then carry the program out to that. So going from starting in the program to the process of the program to the overarching, making sure that it's carried out the way it should. And that's for each activity that is in the program itself or linked to the services you're going to carry out. So you try to make sure that steps are carried out in the order in which they should occur. So if you're going to be working with persons who are going to participate in a behavioral program, that means you got to first screen people. You got to put them in the right categories. You got to make sure that the services that you're trying to provide for them are the appropriate services they need at that point, and so on and so forth. Check the dates, times, and the primaries on that, and then determine how each step should end. So you should have an endpoint on that. The other parts to keep in mind is the timeline part. Make sure that the people that are doing the work of this are affected by this is know how things are carried out and what's the implementation. The other big thing is making sure that you ascertain all people involved are very clear on what happens. And so I say that because one of the real challenges that happens many times is that decisions are made by leaders that are not necessarily either understood or agreed with, by those who are responsible for carrying them out. And I say that because implementation is so critically based on those who are going to be the frontline folks who are going to be responsible for that. So part of your leadership role is to make sure that you are clearly communicating with those who are responsible for carrying the program out, which also means that you're doing the other things you mentioned, which is ascertaining their level of skills, knowledge, their level of willingness to have the work out and that sort of thing. And I know it's controversial to talk about willingness to do the work, but that's real critical because you want to make sure everybody's on board. You want to make sure that some of these services, particularly the ones that are medical related and or health and behavioral related, people, even the ones you've worked with a long time, to have different perspectives. And so clear that out, make sure that you are understanding those perspectives, making sure that they feel safe, they care to work out, make sure that they're heard, and any questions they may have. Also, just logistics, just the mechanics of carrying the workout itself may change, right? There may be new technologies, there may be, because of the grant requirements, there may be other things that are come about because the funder wants things done in a certain way or about a certain way and so forth. So all of these things need to be done. So that's why I say in the last bullet, make sure you put in place a clear, sound, consistent, and readily accessible and communication and problem solving plan. And what I mean by readily accessible is I mean that the communication itself is something that everyone feels very comfortable using, and that it's not a one-way communication, that people feel that it's a back and forth communication, and that it is problem oriented. I mean, it's problem solving oriented, such that, if challenges that come up, that you collectively look at them and you work with them, and that everybody, no matter what level of work that they do, either in the program or the services, feel that they can be heard, listened to, and worked with. And whether or not at the end of the day, you all come to a mutual agreement, that's what you want. You want to have some kind of that. But negotiation here, as we mentioned this, our last meeting about how important negotiation is, that's important here. You may not come to something everyone feels that they agree with. However, what you want to be able to do is that you want to be in a place where whether that's something that everyone feels they may not necessarily fully agree, but they are going to do the work because that's part of the overall way to get things done. So problem solving around being honest, open, and having respected input is going to be very critical to your implementation part. And so that's what I want to talk about here in terms of challenges. So there's a whole lot of challenges to deal with when you're trying to put together and implement a program plan. And these are just some of them. And I sort of, it's not an exhaustive list, but it's a list that you all should be able to recognize, understanding these. And I just want to highlight a few of them, particularly around the second bullet, which is understanding the administration, and everybody involved, which are your stakeholders. That's a critical piece here because that challenge is something that is going to be consistent and not go away. You're going to run into that all the time. The other thing is the accessibility of the services you have is going to be something that you deal with initially, and It may seem that you've dealt with it well, but it keeps coming back over again in different forms. And adjusting to change, particularly change, in the way that you're supported or the way programs work. And we talked about that last time is there. And then policies and procedures are going to have to be adjusted to. The other part is a leadership part. And this is just speaking to you all in a leadership role. Poor management is is really a way to set yourself up for things. You set yourself up for just things not working well in the short term, in the intermediate term, and in the long term, because people don't forget. They do not forget. If you talk to folks, particularly folks who've changed position or jobs, this is one of the things that they will always bring. They will bring up. And they will always remember this, no matter how, even if it's something they love or they did. And this is one of the reasons actually also why people leave jobs that they love or they did, is because of the way that that management carried out the work that they did. And we're hearing that these days now. And it even came up, you all know, during conversations with a lot of workers, particularly during this COVID age, as people were quitting their jobs or changing their jobs. One of the things is just this decision on that. Besides, the being burnout from doing the hard work. The unresolved cultural, racial, ethnic matters is just, I mentioned this earlier about the environment in which we live, where we're becoming a much more diverse in so many different ways. And a lot of times these are historical. You may come in as a leader and this has nothing to do with who you are, what you're about. However, these issues are there because of history. So it is important that as you're thinking about what are some of the challenges you need to address with, that you also make sure that these are identified and that to your best of your ability, you're dealing with these types of issues. And social issues as well, in terms of how people were treated based upon how they identified themselves is also in that there. And these may be unresolved, or they may be limited in terms of how you can resolve them, depending on the environment and depending on the job you have. However, it's still a challenge and it's still something that you should deal with. And of course, the constant challenge that we have who work in this field, we never have enough people, equipment, money, funding, and so forth. That's a given. That's a given. And so how you make sure that you be anticipatory about that is going to be important. And then an acceptable service or dissatisfaction with services from the clientele you're going to have. You're going to have a small group of people, no matter how well you do what you do, who in and of themselves are not going to be real happy on how services are carried out or work is done. And so there's the challenges that you just should anticipate and have that in place. And either you as a leader deal with it, or you have persons who are really good, at dealing with challenging persons, work on this thing, delegating that work you're going to have. So those are I want to pause here for our break and want to see, I've covered a lot of things before we move on to our break, but I want to stop sharing the screen and before we move on to the next thing and see if you have any comments or questions. Okay, so according to the schedule, then we have 15 minutes. So Ms. Roberts, if we can keep the clock for 15 minutes, and then we'll come back at 15. I know we're a little earlier, 12 is the time, but we're a little early, so we can do 17 minutes and come back at 12:15. That would be great. Or more
Sounds
than that.
good. Thank
Okay,
you.
all right.
We'll
So come
send-
back at 12:15 and we'll start back up again. Thank you all. And if you have any questions, we can start off with questions and move on from there. Okay, thank you. See you at 12:15. Okay.
We're
All right,
good.
so we're good to go. All right, so first of all, before we get started, I just want to see if anybody had any questions from the first part of the session today. Questions, comments? Okay, So to orient you to this part, so what we have here is we have a bit of a shift in emphasis, if you will. This is a kind of something old, something new section here. The old part is going to talk a little bit about, because this is critical to program development and planning, is really understanding the needs assessment process. Now, I know many of you, if not all of you, have conducted needs assessment in one way, shape, or form. So this may be it's going to be a bit of a review, but also I'm going to add a couple of things, hopefully, that you have not considered in your review process. And in the I'm going to finish with giving you a framework that is used often, particularly for you all who work in the REACH type projects or the diversity, equity, and cultural challenges areas, and also in the clinical services area. A framework that I think that is used a lot, and I want to go over that with you. I want to end with that and for discussion, and just give you a bit of a setup for something for you to look over in preparation for the next phases, which is going to happen in the spring. So, or having had that sort of brief commercial, I will now move to the content. All right, then. So one of the things around needs assessment is that you consider the appropriate way that these are done. Now, I know that because I've worked with many people, we've worked with many people, you have different ways you look at needs assessment. However, structurally, and in the way that you best will benefit from it is what I want to have as my emphasis in this last part of what we're going to talk about today. So why do we do a needs assessment in the first place? You know, to make sure that we're up to date, where we do have a good understanding of, in general, of what's going on. However, we not have as full of an understanding of what's going on as we need to. So carrying out a needs assessment part is a really good way to know that. The other part of it is that many of us are fortunate to have new projects. And these new projects themselves may be new projects with new population or new projects that allows us to explore more with the target groups that we're trying to work with. And so a needs assessment allows us to refresh, either learn new things or to refresh and get new information about either new groups we're working with or not. It also pushes us, and it's really in the core of program planning, is help us to define our goals, our objectives, and what it is that we want to do in terms of the program activities. And it allows us then to say, yeah, this is what we want, how we want to do it, and here's the evidence, you know, or the information we need to do this. A part of it is also defining, you know, our philosophy, or as we would say, your philosophy of practice, you know, effort as well to pursue that. And this is really critical. So this is where it's important to remember that when you do your review of your program, which we recommend every 3 to 5 years, is that you also do a needs assessment of the population, even if you've been working with them a long time. It's really good to get yourself a refresh because that refresh is very informative, and they're going to be things that you overlooked or you forgot about and so forth. That's the real good part about that. And also your philosophy of practice. Should you change the way you approach working with certain groups of persons? Or you work with certain group of persons or your partners? You know, are there new partners now that also have some way of helping and assisting getting done what you need to do? And do you need to also rethink of how you work with them? And have they changed? You know, or they stayed the same? So the other part, of course, is all going to be the rules and regs and the policies that have come down. And we have experienced a lot of this in the last couple of years, you know, where we have rules and regs and laws that make it, let me put it this way, challenging to do the work that we do. And so we have to also now assess those rules and laws, how they fit, how we can work with them to make sure that we still get to do what we are able to do. So some general principles. So the needs of the population and resources are ever changing, as I've said over and over again. And so that means that needs assessment is an ongoing process. It should be something that you do fairly regularly. The federal government, as you know, recommends you do it every 2 years. If you have, the Affordable Care Act and you're being supported by that, you're required to do that every couple of years. The other part of it is that it's a core function of any kind of public health and social service agency is to constantly assess, who's out there, who are you functioning, who are you working with? And then of course, because, part of our reality is that there's ever rising and ever appearing and ever dealing with the public health issue or the social service issue of the day, right? So COVID is one. We were dealing with the opioid crisis. Before that, we were dealing with issues related to poverty. Before that, we're dealing now with this trifecta or quadfecta, if you will, where we have poverty, we have financial changes, we have social justice and diversity types of issues, as well as we just have a reality of dealing with just being able to continue to function in the work that we do. We have emotional and mental health type of challenges that permeates at all levels within ourselves individually, within our social, family, other groups, within our community as a whole. So that's 4 areas that are sort of overlapping. So this is a time, as I said before, we're not living in usual times. We're living in a very unusual time where we actually have these very, or they're not very degrees of these challenges. They are all coming at us from multiple ways. Oh, and I should admit, I forgot, environment, physical environment. Our environment is changing. Our physical environment is changing. Hotter days, colder days, worse storms, all these things. And then knowing that a lot of what we have done or are doing, has caused and have these things done. So we have these 5 major areas in which we are trying to carry out the work that we need to carry out. So the needs reflects the population focus. And we should have, as part of our work, a prevention orientation. And of course, it's consistent with our own advocacy responsibilities that we all feel. So those are general principles that guide us. So needs assessment, if you will, is a way of identifying and documenting resource and strengths of a program and unmet needs and gaps in services. And I'll talk a little bit about the strengths of programs and that unmet need and gaps in programs in a second when I talk about an asset assessment, because I want to give you a slightly different way of looking at and suggesting to you something that you either should do if you're not doing, or add to if you haven't done so when you do your traditional needs assessment. So developing and implementing a plan to meet these needs is critical. Like, for example, health status assessment and monitoring. But within the context of program plan development and monitoring assessment, you really need to consider this work and what the influence needs have on that, as well as, excuse me, the policy and advocacy analysis. So where are you coming from on this? How far do you go? What steps do you make? When we were talking about systems change, and we were just making a decision about systems change, we all, I think, came to the conclusion that system change also involves us making decisions about how far do we take our advocacy, and then what are the decisions you're going to make on that. And that's critical for us to do. So keep that in mind. Now, what I want to say then is that the ongoing process of needs help us answer a couple questions. And these are some of the basic questions that here, and these are just the basics of the questions. They ask us, what do we need? Who has the need? Where are those need? Who is currently being done? And that includes not just our target population, but our other stakeholders as well, those that support us and fund us, those that we work with, and so forth. And what and where are the unmet needs? And I would argue that much of what we do focus on unmet needs. And I would argue that it should not be, the level of focus we have on unmet needs shouldn't be what it is. We should have a balance. And I'll talk about that in a second, a balance between that and a balance between enhancing our assets. That's what I'm saying. So I know we focus on unmet needs because that's normally what we do. That's how we define ourselves and what we want to work. However, I would suggest that we do not have an adequate focus on enhancing our assets. And I'll talk about that in a second. How well we do what we do in addressing these needs and what changes since we started. And that goes back to our systems change part, and that we have a good sense of this. So if you think about why is it and how we are able to apply for what we do and get support for what we do, is because both we and those that support us focus a lot on unmet needs. And unmet needs, appropriately so, are there. And because of that, we also have come to understand these really very, very well. However, what we need to be able to do is also look at what do we need to have in place and what do we have in place that allow us to continue to address these. So what I'm focusing on then is stakeholders, which are key or individual groups that are identified early. And these stakeholders directly or indirectly impact our ability for the needs assessment process. And that includes helping us to better identify who our target population is, better to understand and identify and understand who receive the services, better understand who are able to be our partners in terms of providing services, who can support the work that we do, be it financially and otherwise, and even at what level, national, state, local, individual, so forth. Who are the policymakers? How do they make the decisions? What is their history of decisions they've made? What are the recent work that they've done? Are they accessible? Can we work with them? So forth. And then members of the community in which our target population lives, which is who you all deal with the most. So needs assessment, I just give you a bit of a primer, and a reminder and a refresher on that. So let me move to something that we all need to have a little bit more discussion about, which is type of needs. So as we said, needs can be defined as discrepancies between what it is, what we want to achieve, and then what our actual situation is. And so that means that when we're thinking about needs, it's more than just focusing on, what's not there. We also need to look at the difference between what we compare to be needs and what's prescribed. In other words, then, what do we look at where, depending on our situation, we think there's a gap or a need? And then what is actually something that is genuine? What is the prescribed need? So what is expected, what's wanted, what desired, what we feel, and then what are people saying, or what are those saying, and what did we assess? So express needs comes, more than roughly two ways. One is what we're told based on things like asking persons, asking groups, or whatever. The other one is what we observe. What do we see as gaps, and what do we see based on conversation, things that we have? And then we extrapolate that, what is it that we pull out based on this evidence building process that we actually see is there. So that means that when we do comparative or prescribed needs, we actually need to be very systematic in how we do this. So this looks a little, involved, formulas, but it's actually what you intuitively do already. So what I want to walk you through is a couple different ways, to address the type of needs that we have. So instead of just talking about type of needs, I want to walk you through how do you make a decision about type of need, because not all of these types of needs are the kinds of things that are applicable to your program. So let me repeat that. Not all the type of needs we're going to talk about are applicable to any one program. They may overlap, they may not apply at all, or they may be what you need to assess a new or emerging effort. So let's talk about comparative or prescribed needs. So typically they're based on what's called a target state. In other words, then it's defined by an expert, yourself. You would say that. And it's a difference between what is ideal and what you actually need. So, we're looking at the IMR, infant mortality rate, for example, and you're trying to assess this because you're trying to decide on how to put together a maternal infant support program. And so that would be the difference between non-infant deaths versus what state or local rate would be. So the ideal would be to set up a program where there are no deaths at all. However, what you need to be able to look at is what the reality is and what's actually there. So what are the actual deaths at that level? Social discrepancy, between what's the norm, between national, state, and local. So again, what is the discrepancy between what's perceived as high rates of infant morbidity and rate, and the infant mortality rate? and what you see there. And then there are between the discrepancy itself, even subdivide in the sense of what is minimally you want to do, say, compared to, years ago, 1980 and the current rate. And the reason why we use 1980 is because 1980 is when a lot of this came about, and particularly in terms of infant mortality, we began to do a much, much better job in assessing these things, and for example, that's when Healthy People, as you know, oriented it during that period of time. And then optimal discrepancy, say your 2017 objective versus the current rate. We just go back a little bit. So we know optimally in the last couple of years, what has happened between 2017, and then we have to look at contextually, what do we have to look at when we know that did this change based upon what we perceive as regular rates, or because of COVID and other things, did we also see these changes? So the other part is the other types of need, and this is defined by our population, tell us what they are. And these are like self-defined gaps. So expectancy discrepancy is that when people, and this is important to know, this already, is that this is when I was talking about earlier, and to relate this and to this is that what persons believe are their own challenges and what level of confidence they have in you to address those challenges has a lot to do with what their expectations of what you do are. So if the actual difference and say infant mortality is not as high as people think it is, that needs to be assessed. And then something needs to be, you need to put in place some kind of, or something that allows them to be able to understand that. So maybe similar to the social norm or their expectancy. And also what it is that is you want them to do, which is the desired rate is where you want to go with this. So if you are trying to work in an a maternal infant mortality program, and what you want to be able to do is get as close to zero as possible, that's your desired, then actually how are you progressing with that? You put a program up to do that, how are you progressing that way? And then express discrepancy in terms of your ability to get this done. So expectancy is kind of what people think. Expressed is what they're saying needs to be done. What is the demand? What are they demanding? So typically you establish these based upon like your things like clinical operations, like program management, and that information, like sharing stuff and information you have out there. So it's really important when you deal with the different types of needs, comparative or prescribed versus, expected one or desired, will have different types of information, different types of variables and measures and indicators that you need to pay attention to. And so extrapolated needs, which is what we talked about here earlier, is applying to figure what you're trying to look at. So if your local, regional, national estimates are known, can they be applied to the local population? Now, this is what you already do if you ever applied for a grant. You've done extrapolated needs. You've looked at the local, national, regional estimates, and you've used those to justify your target population. And so what the needs are, what the unmet needs are, that's how you've done that. And so you have not necessarily, you have, addressed expected, wanted, or desired or felt needs, or even comparative or prescribed needs. What you've done is dealt with population level type of information. Now, I do want to say that the other needs themselves can be addressed based on your constituencies or your clients, as well as those who are funded, particularly if you are receiving funding or support from a local philanthropic organization who has a very specific expectations, very specific target group, and very specific understanding of what's really needs to be met. So it's really important in your planning process that you make sure that that is really clear to you. And many of you already do that. Many of you have communications with some of these local groups that provide resources for you, particularly if you work in agencies like the Y. or agencies like the food banks and those sort of things. A lot of those local persons really share with you what they think is there. You have to make a decision on how much that applies to that. You also have to be very understanding as well as knowledgeable about the different types of needs and what approach do you need, what approach should you take when you're addressing these needs. So likewise, with extrapolated needs, you're looking more at population level addressing this, and you're looking at ways in which you can document that and then share that. So there's also, while there's different types of needs, there's also different foci of the needs themselves. One of them is health and social service needs assessment. And what this pertains to is that you're getting information or evidence, about the potential implementation of service interventions that's designed to focus on health issues, social service issues, and that. Now, that could come out of what you've already done. However, now you're taking these broad needs part and you're narrowing them and you're focusing on a particular health issue, social service issue, mental health issue, concrete need issue, that sort of thing. And so that could also be then where you get your information from on this one as well. And these are just some different areas, and I'll highlight one or two of these, which is documented needs and services. Like, for example, if you're dealing with the CARE Act and both CARES Act, the current one that's coming down the pike, from the current White House administration, or the previous one, which is the Obamacare Act. The documented needs and gaps in services is kind of what they're looking for, particularly around health issues. And then if you're looking at the literature or the information that we're constantly documenting, particularly during the things where you have opioid assessment and everything, you also know that there's a lot of information, people that are trying to support that, and it's focusing on needs and gaps related to mental health and services, and then substance abuse and recovery and treatment, and you're really on that. And then it requires that you also have some means, if you're going to apply for these supports or carry out these supports, you have some built-in consensus, and that you also figure out a way of how you're going to determine if these needs are being met or not. So that means that you have to focus on and have a good understanding of the data that allows you both to assess the need as well as determine if needs are being met and carried out. So a little bit about that. So population-based social indicator data, or the population-based data, these comes from records, they come from census data, they come from local census data. A lot of what CGIC does, this is where you would get data from them on, survey data that you've done yourself, focus groups and other groups that you use, like structured groups, and then of course your own program and services data that you keep for yourself. You're able to use that information. And so then what do you do with that information? Well, there's a whole list of things in terms of the needs assessment itself. So you analyze the data, you find the findings, but then help you inform you on decision making. So the development and planning, as we've said many times already, has a lot to do with decision making. And so all the last bullets, for the most part, deals with the decision making process around what interventions are realistic, what are the priority ones you want to have, what are the ones then that you pick from the priority ones, how do you put together what you need to make sure you address those, and then how do you carry that work out. And all of the stuff we've talked about so far on this one related to staffing, resources, decision making, measurement, and so forth, all those things are elements by which you carry this work out. So sequentially, if you look at the way we've talked about development and program planning, we've sort of put needs assessment close to the end of the presentation as opposed to the beginning of it. And so some of you who've done this work will probably be wondering, why is that? Well, one of the things that's so critically important is that needs assessment and the kind of assessment and work you do is part of the process or the sequential work that you do. It is so critical that that you think about, you front load a lot of the work of the decision making and everything around decision making and planning. You put all that stuff first, because if you get that right or do it well, the rest of what you're going to do, which are needs assessment, monitoring, evaluation, all that stuff, is going to flow very, very well, because you'll have clearly identified and refined goals, objectives, purpose, vision, and so forth. Clearly defined population, all the rationale, all the issues around that. Clearly defined staffing, what you're going to do. You've dealt with the political, the social issues. You've dealt with the diversity, equity, inclusion type of issues. You've dealt with a whole lot of those types of things that confound or influence your ability to carry out the program and service-based interventions that you're going to be able to need to do the program in the first place. So that's why, in the discussion, we've moved the needs part to this part of it and had spent a huge amount of time on those other types of issues. So in case you had a question about that, which some people do, then it's been expressed, that is why. So what we're trying to do is get you to think about this in a very systematic way, and see the benefits of that system that allows you then to do your job and even more enhance your job in the work that you do. So that's kind of what it is. So I'm going to have a few notes here. So first of all, the most important point about indicators as it relates to need is that they must be as relevant as possible to the group that you serve, as well as to the program that you have, and that, because the way you're going to measure this and the way you're going to pull things together and the way you're going to do your needs at work and that sort of thing is going to be that. And that's because, again, change. So characters of a good indicator, and I'll talk about this coming up when we talk about evaluation, are these, and we'll show you this again. So I just wanted to show you this part, and this is also in your 8 steps manual in terms of what makes a good indicator. But before you consider that, consider this: establishing priorities for your needs. So the reason why you were able to do that other work is, now if you think about, if you've made all those other decisions in terms of that, you were able to walk into your needs assessment with a much more clear eye than you did before. You can much more straightforwardly decide on what your challenge is, what your problem is in terms of size, seriousness, and then the perception of the need from the community itself. You also can think about what it is that your need is in terms of how you're going to address those, in terms of effectiveness, feasibility, both economic and political and so forth. What are the legal issues and what funding you need and so forth. You also are going to better be able to identify what your intervention is going to be, what your existing resources is going to be, and then consider what's appropriate in terms of how you carry the work out. And this is particularly true if your needs assessment was done based upon an existing program and you're doing a reassessment, your 3 to 5 year reassessment of that program or that service. And then you're looking at these types of things under consider all approaches, which are, the idea that the service, do you design and carry out the service slightly different? Do you also invest in that program? Do you look at quality of the program itself in terms of what's being carried out? Do you need to add and enhance what's being done, and so forth? And then conduct any kind of assessment in terms of models and work that are really there. And think of the different ways that consider how your stakeholders are reviewing that, and in what framework that you think is best for that. So I would suggest that is important when you're carrying this work out and you're really looking at, how do you prioritize it based upon what you've learned so far, is that you look at these last 5 bullets, which is setting the need for the program priorities themselves, developing the type of intervention that you think, that based on your evidence is really there, resetting, or setting program objectives, you're monitoring your process, and then solutions that you see and visualize you think is going to happen. So those are needs assessment, and those are the considerations and critical parts of needs assessment. So so just as a brief way is understanding that there's different types of need and they fall in different categories, that the different needs you have may be singularly appropriate for what it is you're trying to do, or they may overlap for what you're trying to do. It requires that you have some degree of prioritization, and I've given you a framework and a way to look at that prioritization, and then some degree of how you achieve that prioritization, and who is it appropriate for and what you do. And that all the decision making and all that effort that we talked about before, how does that fit into that part of it? And so like I said, it may be a bit of a refresher for you as a reminder and new, but consider it. Okay, so what I want to move to now is something that I would like you to think about slightly different, which is asset-based assessment. So we are accustomed, because people, when we apply for work, for support or resources, or we work with others, we only talk about needs, unmet needs, and that sort of thing. And our gap is based on what perceived versus actual. And so that's kind of how we look at it. And that's the world we work in, as in the not-for-profit and community-based world. However, there is another area that you probably do, but you don't think about it in the way that I'm probably going to talk about it, is that you have resources that already exist. And you think about this in terms of how you leverage these resources in such a way that they can be used to support whatever your program, whatever your service, so on and so forth. So, and sometimes you're asked, to just give an overview of what resources you have available to you. And so that's fine, but it's done through the lens of what we call a deficit lens. In other words, then the unmet needs, the negative stuff that goes on. But it doesn't say, how do you bring it, what are your assets? In other words, what do you have in place that it actually is working, this not because of, but despite of the negative things that go on, all the stuff that exists, like high rates of crime and other kinds of things you work with, high rates of poverty and crime and disillusion and disagreement and so forth. Yeah, those things exist. However, people still able to put one foot in front of the other. You're able to program to put one foot in front of the other. So those are called strengths. So strengths are as important as weaknesses in deciding on how you prioritize a program, particularly when you're designing the program and when you're assessing the program. And so this is called asset-based assessment. And some of you may have heard of it before, but it's very critical. And I wanted to make sure that I in our part of it with you is talking about asset and this for program planning, because in the social and public health arena, it creates greater opportunities for you to both discuss and to consider, how you do program, population-based program, prevention-focused programs, and then systems-targeted programs, like changing the system itself in terms of that. So asset-based suggests that there's the need for more population-based data to describe the very complex, very vexing way in the world we live and the opportunities that actually exist. So, for example, when we're looking at the issue of infant mortality rate, there are population-based data that tells you both things that are positive and negative about pregnancy outcome. And can describe, these experiences in terms of risk and that sort of thing. But there's the other side of it. It's that, there is, a focus on the strengths and how are people able to survive and be supported when they have these challenges. And these are more of a focus on the problem itself. And that's kind of, unfortunately, when you're asked to provide apply for resources, this is kind of what you're asked. And it doesn't make a lot, about, the good health issues. It says those as outcomes, but it doesn't talk about the already good things that are going on in the area you work in. So asset is a revised approach to people and communities. And so the reality of it is that communities often have extensive health and social service systems that are just that they exist already, but they exist at different levels, but they're there. The point of it is that they're there. They give you faith-based mental health services, health clinics, social service programs, and that sort of thing. And you all work in many of these, and that and even though you apply for funding to support the more what we call deficit approaches, which are the negative side, you actually are an asset that exists there, and it's an asset that addresses effectively and have been addressing effectively the needs of these communities. So the more, reality is the more a problem committee can document, the more resources they get. That's how they justify what you need. People a lot of times so what does that look like? I'll give you a drawing as as I said before, you can imagine drawing it. So this is what's called a deficit map, right? So when we talk about our communities, this is what we're saying. We're saying there's like high rates of unemployment, there's gangs, there's broken families, there's crime, child abuse, literacy, that sort of thing. All true, not all true. Don't get me wrong, all true. However, that should not solely be what we're talking about when we go at and when we look at what we do. That is not solely what people you work with talk about all the time. They do have challenges, there's no question, and they fall in these categories, no questions, but they still find a way to put one foot in front of the other and they work. So in terms of needs, it's critical to assess the needs, which is what this map is showing, and consider what that is. And there's an alternative pathway. So for every area by which there are deficits, there are other areas in which there is capacity to focus on development. So when we are talking about a solid plan for development and planning, we need to also have this bifurcated side-by-side parallel consideration that we're looking at. So yes, talk about fragmented efforts at solution, but also talk about policies and activities that are based on the capacities, the native capacities and the assets of that community itself. So for every area in which there is the slum area, there are churches, there are community gatherings, there are other types of things that exist. Okay, so yeah, so that is kind of what we have, what's there, but we could say these others could be leveraged, to provide areas where there's solutions. Think of a lot of the inner city areas we work in, or even in the rural areas we work in. There are these sort of spots where people have decided they've come up with community gardens, they've come up with playgrounds, they've come up with church activities at the end of the day, community service activities at the end of the day, so forth. So where there's deficit funding, there are people who are willing to volunteer and commit resources. We've seen that so much during this period of time, during the COVID period of time, where people have just taken it upon themselves, to volunteer when they know resources doesn't exist. We have one of the best examples of this. One of the best. We have many examples of this, but one of the best ones, is American Second Harvest. That we have. When the need is there, people donate massive numbers of money and food. And in American Second Harvest itself, as you all know, then they also pay it forward. They reach out to others, like during disasters and things. And we've had discussions with them where they go out of state and help people like in Mississippi and Tennessee, and even as far north, I think, as in the Pennsylvania area and that sort of thing. So we can say that communities, besides the fact that they have these things, these deficits, needs, they also have assets and capacities. And so the question really becomes, how do we draw the map? How do we look at the map? So let's rethink the map I showed you a second ago, and let's think about an asset map. And so this is what an asset map would look like. And so where you have these other areas of crime and work and that sort of thing, you also then have alternatives that are capacity. So businesses, local institutions, churches, parks, hospitals, community colleges, so forth. You have answers that are alternative ways of looking at this. So the questions becomes, when you're doing development and you're doing this work, you should definitely look at what are the needs, but also what are your assets, and then what's the gap between the needs and the assets. And also when you're really considering, what are your prioritization, and what is the work you do? Do you work towards enhancing the assets or simply just trying to address the need? So the question becomes that, do you just say, I'm going to focus on the need and how we've described it, or I'm also going to focus on assets and how do we enhance these assets? Because we all know, and it's evident, you know, and you may know this intuitively, or you may know this from lived experience. If you work towards not only just meeting needs, but enhancing the assets that you have, the probability that the efforts you're trying to get done, or what you're trying to achieve, the changes you're trying to make, will be high, the higher the probability that they will be more sustained than if you simply focus on needs. Needs will always be there, there's no question about it. But assets, just like communities themselves, do change if they're not supported. So what I'm suggesting is that when you are doing a needs assessment as part of your planning and development and your considerations for systems change, consider that asset enhancement or capacity building and sustainment, it is as important as addressing and planning for, the needs that are there. So, and like, for example, an asset-oriented health system that we're working more, whether it be physical health or mental health, is as critically important as a need-based, system that you're really addressing there. Because think about it, if you have a really good in-person or even outpatient health services, people still have to go and live in the communities in which they live. And if you're not supporting the communities in which they're going back to, we all know what the recidivism rate is, particularly, and our best examples are particularly around substance abuse and that sort of thing, or more unfortunate is domestic violence and those things. Just think, on that one. And if you able to support those type of services that exist, and you provide enhancement with that, you provide, ability for persons to have options, and options that they can rely on, that can be consistent, and that they can actually see is really helping them in that way. So think about this in terms of when you do your community, your assessment work, and when you do your development and planning work, that also should be a major consideration. This is why we talked about, philosophy of practice. And so philosophy of practice is solely going to be focused on just meeting needs and not also on this other area of work, then you really need to, I suggest that might not be as full of a work that you're going to be able to do or can do and sustain work to do. So anyway, I just want to leave you, I want to make that point and make sure that occurs. So I want to move then to the next thing, the 3-phase plan of needs assessment. And as part of that work is the pre-assessment, assessment, and post-assessment. And you know this already in terms of that. So we talked about this part of it. And so then I want to talk about determining ranking priorities, your methodology, how you want to do the work, and then the strategies. But the other part is this stage here, which is your data stage. How are you collecting information? And again, going back to needs and assets. And then what are you going to add to what we've already discussed, our boundaries discussion that we've had, our pulling together the needs on how to obtain them and what are the sources of that data itself. How are you going to pull the data together? How are you going to analyze it and then synthesize it and use it for what it is you're going to do? And then part of this, is the prioritization and the decision-making part of that. And then how you're going to have that as your criteria. And then the last part, of course, is looking at your policy development and how you're going to make that work, and consider this area of both allocation based upon the work you're going to have, which includes how you're going to do your asset work, as well as your need work, particularly putting formulas together for your stakeholders and other people you're going to meet in terms of that work. And then the other part of that, this consideration is utilization. And then how are you going to use that information? And this goes to the evaluability assessment. I'm going to talk about that in a minute. But what you want to do is reassess your priorities of your needs at all levels. So that means taking into account the assets that are there. So are your needs as large as you think they are based on just solely looking at needs alone? Or is there a way that you can also look at needs, but also enhance the assets that exist, to minimize, to mitigate, add some degree of mitigation to actual really needs? Or is it as intractable as you think? Crime is really high, no question about it, but people still live in crime areas. People still work and take care of other families, people who are victims of crime, that sort of thing. Other types of challenges still exist, health issues that still exist. People, need help with transportation and other things. The services are there, but if you live, say, in rural areas like we do, how you can't always rely on, those services. Maybe if you live in, Chatham, you have better access to those as opposed to living in, say, some of the other counties that surround it. So think about that. Think about, enhancing those things. Think about the work that's being done that way, and you will be able to utilize that. So the thing I want to move to is I want to move then to the last kind of closing phases of this and talk about a couple of things. And this is all more of a setup for, or at least a preamble to what we're going to talk about in the spring. And I want to leave you with these considerations. The first thing is that evaluability assessment. And evaluability assessment really is sort of culmination of everything we've talked about, because it boils down to a very straightforward question. You have decided that you're going to put a program together. You've done the planning, you've done the work and so forth. But is it going to be able to work and be carried out as you said? So you need to make sure that you have in place an approach that allows you to evaluate whether or not it's doable or not. And then the other part is to put in place a way to say, do you have what you need to assess and provide information and data for that? So clear goals and objectives, and then measure performance indicators are the stuff that you need. You need also then think about this. So it's 10 steps to this. And I won't go over this. I just want to give you a brief overview. And we'll talk more about this. So identify, in terms of evaluability, who's out there, what's your stakeholders? What is the program you're going to have? Who's your target population? What is the stakeholders' perception of the program? What's the feasibility? And then what are the communication, continuation work you have to do? If you look at these 10 steps and you think about what we've discussed so far, there's an overlap. Everything we've discussed so far goes into this. So if you have done a really good job in understanding what we've discussed so far in terms of your populations, in terms of being clear about your practice, your theory of practice, the way that you've done the work, understanding your population, understanding what boundaries you have, what needs and assets you've done, what do you want to do for your intervention, and so forth, then you have a good setup for an evaluability assessment that you should carry out. That is your pre-assessment or your pilot assessment, of the work itself. So what the questions that it will answer for you, if you do this work, which is to determine whether or not your monitoring evaluation is doable for the program you have, is it allows you to understand the population design. It understands what resources you have available for this, and really just this whole idea, of the capacity to provide data for an evaluation. Now, why is this important? Well, one of the things that happens a lot, us who do evaluation for a living run into this all the time. Not every program, the way that it's constructed initially, or even maybe carried out when we're asked to look at it, is evaluable. You maybe can develop a monitoring program for it, but you can't evaluate, because evaluation means you have to have intervention, you have to have good measures, you got to have good data and so forth. It doesn't mean that it can be, the capacity cannot be grown, because it can be. But an evaluability assessment allows you to make those decisions based upon these 10 things. So if you do an evaluation assessment, this is what questions I would normally, or we who do this would normally ask you. And we put these in there. We have a whole list and a whole questions that we pull together. But the whole point of this is that because you are accountable to whomever is supporting you, be it your stakeholders, be it your funders, be it your clients, you really do have to be able to have some degree of assessment. And if it's only running a program, that's one thing. But if you're looking at services that are interventions, then you really do need to assess growth, development, change. And you need to make sure you have in place the means by which to be able to do that. And that's what an evaluability assessment answers, and that's what these questions answer. So there's 5 tasks that we carry out. And why do I show you this? It's because I think it's important, even if you do not participate in next spring, you should know this because you are, as a leader, these are the 5 things that you should pay attention to pretty much all the time if you're running a program. You know, the HIP program, history, design, and operation. And I mentioned that before. It is so critical to understand how something started. Even if you are not the original director or leader or mid-level, high-level, whatever, you still should understand how the program came about. What is the design, operation, basically the practice philosophy? What is the program? You know, watch it in action. You know, how does it work? How do people, you know, in and out, participate in the program at all levels, not just you or your staff, but how do your participants, the clients? You determine the capacity for collecting information and then who you can collect it from based on the type, because not all data can be collected from everybody. And you're going to have to make a make a distinguishing between what kind of information you collect and from whom, and then also from what source, and how you're going to analyze, manage, and use that data. And then it allows you to look at, and it requires that you look at, how has the program been working? Anyway, consistency between goals and objectives. Has it your overall goal and then the objectives, you know, or the things that you've targeted of how you want to carry it out. And then of course, it answers the bottom line question, as it is currently structured and as it is currently existing, can you design an evaluation for this particular program? Or do you need help in building capacity to do that work? And so those are the things that are very critical. And so this is an introduction to the discussion we're going to have in the spring. And these are things that I think I strongly suggest you consider and looking at, and we will go over this in major detail at that point in time. So let me just end with an approach. And I've given you the handout for this. So that's in one of your handouts. So your 2 handouts or 3 handouts on this is your 8 steps handout, your REA model framework handout, and your 8 steps workbook on this as well. So if you want to know kind of where that fits. So REAIM, what is REAIM? REAIM is a program that was designed pretty much by Robert Wood Johnson. And what it provides you is a program for determining, you know, they looked at it at a larger level. So for example, my colleague in the Y, you run multiple programs. And so one of the things that you're constantly being asked to do either by yourself or others is to make a determination of what of these programs, should they continue or not, right? And it's a basic question, but it's a complex one. So it's not easy to answer. All of you who have programs that has multiple services under them are asked these all the time. So REAIM was designed to help you, assist you, and provide a framework for you to answer those questions in real time. You know, we have programs and stuff I've showed you already that says, use these framework and assess this, but this is in real time. This focuses on how stuff works. This is what we call a practice-based assessment, where it's a practice-based evidence model as opposed to a evidence-based model. As practice-based means that you're focusing on evidence as it's both perceived and used at that time. And what it can be used is to it can be used in larger studies like randomized studies, but it's really designed, and that's the more heavy-duty scientific models, but it's really designed for programs like y'all, and the ones you work with, because the model uses both what's called a mixed method and mixed data design. So it uses both quantitative and qualitative efforts, but a real focus is on inquiry and trying to get at your perceptions and what you need. So it conceptualizes the health impact of a program in all kinds of ways. And it provides you with 5 factors to look at. And these are just, and I'll discuss these and show you these. But the 5 factors are the reach of the program, the efficacy of the program, the ability of the program to adopt or to change, the program's level of implementation and use of that change, and then how the program can be maintained or sustained. And so each of these dimensions are scored by you on a basis of 0 to 1 or 0% to 100% scale. And I'll show you that as well. And central tenet of this thing is that the impact of the intervention that you're doing on these dimensions. So the model itself kind of looks like this, and this is in your handout. So this is taken from theirs, and so it's integrated. So it's not a lateral type of program. The REAIM is actually designed to do translate work, but it's also designed to overlap. So instead of a model that does not have, that is a lateral model, it is, or even a horizontal model, it shows you that it's circular. So that means that you're constantly assessing and reassessing, constantly making decisions of how things work, and then move on to this. It's similar to the one I showed you with the PDSA cycle, but this is like bigger than that. And so it helps you to understand this a little bit better. So let me add a little more detail. So REACH itself, which is the program that you all work on, you know this already because it had this, is the REAIM itself, or the REACH program itself, has this, and it refers to the percentage of that. So within the program, you see that it answers the question. The first part of this is REACH. The second part is effectiveness, adaptation, implementation, and maintenance. So let's talk about part 1, REACH. So what the REACH part is trying to get at is individual measures, and then refers to the percentage of the risk that people take or perceive, in terms of the policy of the program itself. So it concerns itself with the participants, those people who are in the program, and in how they interact with the program itself. The efficacy part is trying to deal with 2 specific issues. What it's trying to ask you about is both the positive and the negative consequences of carrying the program out, whether it be behavioral, quality of life, participants, that sort of thing. But it looks at both positive and negative outcomes. So a lot of times, what they're saying is that you could have a program that's designed to have some kind of positive outcome or consequences, but maybe it doesn't work. Maybe and sometimes it doesn't work. We know that. We've tried stuff that has not worked. So what it's trying to get at in terms of efficacy is answering that question, and it's identifying, cataloging, and assessing that. And then the next thing it's trying to do is to evaluate ways in which that efficacy can be addressed, be it whatever, if it's a target health issue, target social service issue, mental health issue, and so forth. And then what are the risks that goes along with that? And then it try to answer the question like you would in any good assessment is, can you also be certain that what you're trying to do is better than any of the risks that are there. So the risk assessment part is the things that are the harm that's going on. So in other words, then when we are looking at a program, we know that the way that we deliver the program, carry the program out, has consequences. And when we were talking before about making decisions to keep a program or not, or even to carry out a program, how we're going to implement it, and all of the things that goes into implementation, that's what this is talking about. It's really asking you to take a hard look at implementation and figuring out how that works. Then it asks you to make a decision. Does the challenges for carrying a program out, does the benefits of that outweigh that? And then can the outcomes be measured? And then if you're doing clinical research, it's really trying to increase the emphasis on the kind of healthcare you're trying to do. And so the efficacy part for behavioral outcomes, for y'all who do that kind of work, is to assess what's assessed for the participants. And this is a lot to do with that. So a lot of times then you may have a behavioral mental health program, and the program itself, the way that it's being implemented based on whatever design or effort you're trying to do, any kind of treatment program is going to have risk and benefits. And so what it's saying is that does the benefits of the program, particularly treatment programs, outweigh the risk or the potential harm, whatever level that is. And it asks yourself, should you continue to carry that out? Should it continue to be supportive? Should the intervention be carried out that way? And then, of course, it adds in this other bit. So your quality of life. So, quality of life assessments, we all know, has a lot to do with the perceptions that people have about whether something is benefiting or not, be it physical, mental, and so on and so forth, or even just be the way services or access are carried out. So what this tries to do in terms of efficacy is to address that quality of life perception from the point of view of the client. You have your own quality assessment that you do, quality of life assessment, but what you really want to know is that consistent with what the client is saying it is? And it may be, it may be not, it may not be, and if it's not, then your role is to do this critical check of the delivery services, and this re-aim efficacy component helps you to figure that one out. And then once you have those two things, once you sort of looked at the reach part in terms of the clients, and once you assess efficacy, in particularly in regards to quality of life, then it asks you, okay, now what do we do in terms of adapting the program? Proportionate representatives are setting to adopt a program, but really what it's trying to do is examining, what is what are the barriers and supports that allows us to happen. Because remember, we showed you before, with the other model, of looking at precede proceed model, when we're looking at these issues related to benefits, assets, and so forth. But what this is allowing you also to do is examine a lot of the same things in terms of reinforcing, enabling, and other types of factors, but to look at that. So barriers to adoption of program, once you've decided on whether that's going to work or not, and then how you're going to implement the program. And we talked about this in terms of levels of implementation, but the critical piece here is actually the third bullet, which is at the individual level, and you're carrying the program out, once you've made the adjustments, that, are you able now to be able to have reasonable means to get people to follow through and work on the program or work on the regimen that you have? A lot of this model, I should say, re-aim model, just so you're clear, has a lot to do with service delivery, particularly around health assessment and health services. So a lot of the language that's used has a lot more to do with clinical development and clinical services. However, it's used pretty much in social service and other programs as well. It's just adapted in a different way. So the re-aim model itself focuses a lot on individual patient care, even though I know the development planning we talked about has been more population-based. But I wanted to leave you with something that's a little bit more concrete and in real time and in something at ground level. So it allows you then to put in place some of the other models we have, like the PDSA model, like assessing implementation and other types of work. So it's critically important. And the other thing that's pretty important is the setting itself, how you carry it out, where you carry out the work, and then is it being worked the way you have? And of course, all of this leads to decisions related to maintenance, and sustainment of the program. So the big challenge here for you, at the individual and organizational level, is that, are you able to maintain the change? So essentially, what you're trying to do is to make sure that, to whatever extent your health, promotion or practice, or your health delivery, or your clinical service program, or whatever you're trying to do, how close is it to addressing the types of things that are important to the clients? Things like culture, things like norms, things like belief systems, things like, addressing the concerns that they had, quality of life issues and so forth. How are you able to do that? And if you are able to do that successfully, then of course, you're able to have some kind of maintenance related to the program. So these are the kinds of things that you all focus on, as the last bullet says, to keep this thing relatively stable, to ensure that you're going to have high levels of participation, and that whatever the repertoire, or the assessment, not assessment, but in terms of the prescription that you're trying to get them to participate in, whatever level it is, you want to make sure that occurs. And then of course, you want to make sure at the end of the day, you're able to assess that. So the re-aim itself really ends with and focuses on what we're going to talk about in the coming period, which is looking at assessing and how that's structured. So let me just show you model-wise how that's going to look. So these are the dimensions of the re-aim, and these are the levels at which they work. So they work from a lot of the focus is on the reach and the efficacy, as I said, is individual. Then the adaptation is at the organization level, what you do. Implementation is at your organization level. And of course, your maintenance is going to be both at individual and organization level. And then the assessment, of course, is going to be at the organizational level. So this is a way that, to consider this. So consider this model. It is just giving you an example of many that you could use and choose. But given the overall, or given the commonality of you all who are on the call, I thought this would be a good model to look at as we end what we're going to discuss. So my last comments, here, because I'm going to actually give you all probably time back, on this, give you half an hour, maybe more, is that it's critically important as you all who are in a leadership position to at least to have the language and some basic skills around development and planning. Also be able to know how that works when you're trying to consider things like systems change. And when you're trying to look at how you might be accountable for the work that's being done. So that's why we're pairing up both the program development and systems change, and eventually with monitoring and assessment. There are a lot of things to consider from top to bottom, from you all who, at your level to those that may be above you, or if you are the CEO, you, and then those that are at the other level, the staff who are on the front line, the clients who participate in your programs, and your constituents, as well as your stakeholders and your colleagues and who you work with. There's a lot there. And I've given you a lot to think about, given you a lot to work with. But in terms of levels of consideration, take a moment, take a step back, review the information itself. There's a lot there. And we've done our best to try to provide you with concrete examples, hands-on examples, models and frameworks that you could use or adapt, as well as answers to some of the challenges that are vexing you. And then, of course, the other part is, I think I have it. Yeah, so we've given you a lot of resources to also look at. And some of that we pulled there, and others work we have, as well as tools we've handed out to you. So we've given you a lot. And okay, I think I went back to page 1. Anyway, so we've given you a lot to work with, there. And we hope that this has been helpful to you in some way. If you have questions or concerns, please contact us. Here's our contact information, and let us know. And we will try to follow up with you as best we can. And we invite all of you to consider the spring, 4 dates that we have in the spring, to rejoin us. And with that, I will leave it open to comments and questions. I'll turn it over to Ms. Roberts, so you could lead the discussion if there is one, and we can go with.
Thank you, Dr. Telfair. This has been very informative. I don't know about y'all, but you feel like you're drinking from a fire hose a little bit. It's a lot to take in a short period of time. And I think where I'm thinking about is how do we take, so this is our challenge. Let's all take one piece of this, right? And then work to implement it, and then take another bite. And then take another bite. I think this has been great, Dr. Telfair. I've been working in public health a long time, and I learned something new every time we get in these discussions, and it reinforces the great work. And I think for us locally, we want to be growing leaders, and we want to be growing leaders that have great competency skills and can step into leadership roles, and have a cadre of great resources before them. Does anybody have any questions, comments for Dr. Telfair?
I do want to say thank you for hosting it. I've learned a lot. I feel like I haven't had this in a very long time. I'm working for the Y for about 6 years, and it was not only a great refresher, but I learned a lot of new things about even the research implementations. So I just want to thank you for taking your time to do this.
Yeah, my pleasure. Thank you. Yes, ma'am. Ms. Dorsey.
Yes, I just want to thank you and Liz Ann. I'm just saying, wow, wow, wow. This was so awesome. And Liz Ann, just you at the helm with the Coastal Georgia Indicator. It's like a good friend putting the mirror in front of you. So I am humbled at this information we just learned. I feel like I just need to start all over, listen to the tape and pause, make some notes and check the boxes. And also I thank both of you all, and I can't wait to get the recording so I can start working on me and then the program. Thank you.
Thank you, Angela. And, you brought up a really great point. One of the reasons for doing this work that we're doing today and offering this is because we can build a community of practice around this work. And that's really how we learn. We like to learn together. And so I'm going to just say to all of us, including me, that we're all going to learn from each other. We're all going to be going down this road together. And that when we hit a stumbling block, we have this great community that we can call on to say, I learned this the other day, and this is what I'm thinking. Does that mesh well with what you're thinking? So please, everybody, reach out to colleagues on the call and ask for their feedback on as you start to utilize some of this for implementing, because that's the way we learn as adults is really stepping into that place and then trying new things and then supporting each other in the work. Anybody else before we close? Dr. Telfair, thank you again. We can't thank you enough for giving of your time and yourself and your expertise today. And let's all give him a reaction clap. Thank you so much. And everybody else will be back in touch with you soon about the next steps for our, we're calling it spring, but it's really like the first part of the next year of the 2022. Rachel will get the recordings for both the first session and the second session. We'll send that back out to the group that's registered. If by chance, and we'll let you know when we're doing that. So if by chance you don't receive it for whatever reason, please let us know. Thank you again, Dr. Telfair.
You're welcome. Thanks, everybody. Enjoy the rest of your week.
Thank you.
Okay, and hopefully, information is good. Let us know. Let us know.
Thank you. Take
Okay.
care.
Take care.
Great job. Thank
Okay.
you.
Thank you.